Hello and welcome. How exciting. Day 7, the last day of our Lifestyle Medicine Summit 2024. And by the way, this is our fifth online summit, global summit. Plus, we had one bigger in-person conference many years ago in Munich, actually. So we've been in this field for quite some time. And the last day, typically we try to just reach out globally, because part of the beauty of this Lifestyle Medicine Summit is that we have attendees from all over the world, like 40, 50,000. We don't know exactly, we're going to find out soon, but that sign up for the summit from pretty much every country around the world. And we want to also support uh, lifestyle medicine in the different countries, learn what are the challenges, and especially support practitioners all over the world. As you know, our nonprofit mission is to make lifestyle medicine and health coaching accessible to everyone. And I think for all of us to come together and once a year and speak and share and discuss and really have honest conversations is really what we're trying to do here, and support each other. That being said, we have great international panels today, and our first one is Asia as a kind of a bigger area. I know it's a big area, but we try to have presenters that are the leaders in their field, in their country. And so what I'm going to do is I introduce them first, and then we go into the presentation and also the discussion. So first of all, I want to state one thing. Dr. Shiva Puval Singnam, president of Malaysia Society of Lifestyle Medicine. Unfortunately, his father passed away just yesterday, so he couldn't make it. And our condolences to you and your family, and let us know if there's anything we can do. And so I'm going to host the panel, if that's okay. So first, I want to introduce Dr. Shagufta Feroz, the president of the Pakistan Association of Lifestyle Medicine. Welcome.
Thank you. Thank you very much.
So nice to see you back. You already presented, I think, on day 1 or 2, which was absolutely amazing. And also next, Dr. Michelle Palma, the president of the Philippine College of Lifestyle Medicine.
Hello, thank you.
Welcome, welcome. Then we have Dr. Jenny Lee, founding chair, Korean College of Lifestyle Medicine. Yeah, let's see, is she in here already? Maybe not yet. Not yet, okay. Then we have Dr. Rabani Tariq, president of the Indian Society of Lifestyle Medicine.
Hi everyone. Glad to
Hi,
have you.
good to see you. How are you?
All good, all good.
All good, all good. That's our morning meditation or evening meditation, and the exercise and fitness and the good diets we all have that let us walk the talk. So what I'd like to do is, if you have first we start with a little introduction, a few minutes where you kind of share what you do, how you work, and your path in terms of lifestyle medicine, how you apply it in your country. And then afterwards we go into discussion and let's see where it leads us. So Dr. Feroz, you want to start?
Yeah. Thank you very much. And on behalf of us, and I would like to say on behalf of Asian Society of Lifestyle Council, Asian Council for Lifestyle Medicine, we all would like to offer our condolences to Siva, who was rather very important. His presence was very important right now, but we can imagine the amount of pain he might be going through. My primary specialty is family medicine, and I did my family medicine practice for about good 10 to 15 years, and I learned actually on my patients that how limited capacity we carry to manage our patients. So about 10 to 15 years of my practice, I started realizing that we can't cure patients. And because I was doing a private practice, so it started giving me a lot of burden, a lot of guilt that what I'm doing to my patients. So I think after about 15, 16 years of my practice, I started looking for something holistic. I was not even aware of this term of what is holistic. And I landed into Clayton College, PhD in holistic nutrition, which I did in 2000, I think, 7 or 8. And from there, I my capacity to manage patients started getting better. And then in 2013, I landed into the field of lifestyle medicine. And for the past now 15 years, I am running a clinic which is purely a drugless clinic. I don't need to introduce drugs on myself. Yes, if my patients are on drugs or medicines, I never stop them. Their physician gradually withdraw their drugs on their own. So this is my brief personal history, and then later on, I started working on the initiation of this association, Pakistan Association of Lifestyle Medicine, and I use the power of social media to spread the awareness about lifestyle medicine. I because I've been into practice for past probably 30 years, so I go for advocacy at different forums, government forums, even for army, for clubs or schools or colleges or universities. I write, I try to speak, and I do work on social media also. So this is how I am working and trying to align lifestyle medicine with my practice for myself also. For myself also.
Wonderful. Dr. Tariq, would you like to share next? I mean, what's your kind of activity right now? I know you're also very active and especially local in India. What is happening there for you?
Yeah. Thank you, Jones, first of all for inviting me over here. Yes, my background goes actually from preventive medicine and also with an edge of public health, I would say, public health and preventive medicine. I've been practicing for almost like 15 to 20 years in medicine now. And my practice mostly revolved around general specialties and then into the preventive medicine component. And as for any other person who got interested in lifestyle medicine, it was mostly related to the root cause of the disease, with the specific areas related to chronic diseases, wherein we came across patients through various strata of, I would say, sectors of life and socioeconomic disparities, wherein most of them came with the complaints of that the control and the alleviation of the disease does not happen over a period of time. So it continues to grow, it continues in its severity. And because of that, the frequency, the dosage, and of the medicines and all kept on increasing. So one essential intervention that we found out in terms of preventive medicine modalities, because we were having certain clinics in terms of preventive diabetology, preventive cardiology, and now preventive oncology as well running. And for that purpose, we landed up into this modalities, lifestyle modification in modalities, so that we hit the root cause of the disease. And that's how this particular series of inception of development of lifestyle medicine clinics started back in around, I would say around 2017 or something like that. So since then, I've been involved in setting up of clinics in different areas of the country, especially in my own state where I come from, that's J&K. And we've been fortunate enough to develop these kind of clinics into the government setups, and through multi-speciality clinics where we had a cardiologist, endocrinologist, all in an in-house setup. And then we had a preventive medicine physician as well, and focusing primarily on the lifestyle modifications. And because of this, what exactly was possible? Because in Indian subcontext, I would say rather Indian subcontinent, we have a tremendous amount of patient load coming, pouring in especially in the public sector, and it's not easily possible to cater such a burden of patients, wherein the usual OPD runs in hundreds, with a doctor population ratio around that. And for that matter, yes, of course, it's about mostly about writing prescriptions. When it comes to kind of importing and suggesting lifestyle modification prescriptions, or for that matter, the lifestyle modification advices, that used to take a backseat because of the paucity of time. And because of such initiatives, wherein we could brought in lifestyle medicine clinics, which used to be operating maybe once a week or something like in an earmarked time slot, calling these chronic disease patients or even chronic disease related beneficiaries. So that was the inception of all these lifestyle modification modalities at our place. And because of that, we were able to kind of educate people out there, make them understand what is important, how can you control your severity, progression of the disease. And up till
Mm,
now, we have done
wonderful.
fair enough in the sense that we've been able to do lots of initiatives from the Indian Society of Lifestyle Medicine in different parts of the country. And just I would say some days back, we had our conference in the capital of the country as well.
Wonderful. Yeah, I'd love to hear a lot more about this in a minute. Dr. Palma, would you like to share like your situation in the Philippines and what your work, what you're involved in right now?
Thank you for having me here. I'm so excited to share with you what's happening in the Philippines. Philippines is like any other country. We're bombarded by non-communicable diseases. Our people are dying of the same NCDs like the Western world without the healthcare benefit. That's the problem. Lifestyle medicine has started as early as 2000 in the country. So, fortunately, Philippines has a good foundation in lifestyle medicine because of the Seventh-day Adventist hospitals that are closely related to Loma Linda, who's really into lifestyle intervention. It wasn't lifestyle medicine yet, but it's wellness, it's lifestyle intervention, not literally lifestyle medicine. But in 2015, a group of physicians have actually organized themselves and called their organization as Philippine Organization of Lifestyle Medicine. However, the society was kind of labeled as a revolutionary medical practice. It turned out to sound like against conventional practice, and it was initially misunderstood. So we reorganized in 2019, and it's called the Philippine College of Lifestyle Medicine. And so we were able to penetrate the Philippine Medical Association, and right now, the Philippine College of Lifestyle Medicine is considered as a medical specialty society in the country. So lifestyle medicine is already one of the specialty practice in the country. And just recently this year, we launched the clinical fellowship training in lifestyle medicine, and this is all facilitated by government hospitals. And these are the largest healthcare system in the country. And as we speak, there is a current ongoing training for primary care physicians and public health workers, basic training in lifestyle medicine. And then from there, we would see who's going to go through the thorough training in lifestyle medicine so they get to be certified in lifestyle medicine to become a diplomate. So we have different categories in lifestyle medicine education as of now. There's master's degree, there's undergraduate medical education, there's diplomate certification, and there's fellowship certification. So it's embedded in the primary care practice in the country already.
Exciting news, exciting news. So let's go into the discussion and talk about, I mean, most of us know about the need in terms of the chronic disease epidemic, but if you could talk about that locally, what are the most common type of chronic health issues, which very likely going to be around the world the same, right? But what's the uniqueness in your country or area? And then specific ways how you implement that lifestyle medicine into your healthcare system, which some of you have started to mention already. So, Dr. Ferozi, you want to be next?
Yeah. Besides whatever I have mentioned earlier, I would like to add, like my colleagues have mentioned, that we are working at different levels. So the academic part is being done in the university. So the first ever Institute of Lifestyle Medicine was started in 2019. So we are training postgraduate doctors, and we have inculcated lifestyle medicine into the curriculum of medical college as well. Then there are community 6 weeks community training programs, and there is a club which is called the Vanguard Club of Self Care, which I have started for the medical students for their well being. So, as you ask about the prevailing issues, so definitely Pakistan is probably at number three position. I'm not very, I can't exactly mention, but I think it is at number three in diabetes. So diabetes is like an epidemic in Pakistan. Number two disease which I have been observing in my patients is early onset of ischemic heart diseases. In my practice, I observed that I think about 15 years ago, it was after the age of 40. Now I have started observing even after age 20. I have seen two young boys who have gone through cabbage at age 22 and age 24. A lot of young guys, they are going through angioplasties. So unfortunately, I don't know about the statistics from rest of the countries or rest of the world, but I know that the cardiac diseases have started hitting younger age group. And fortunately, probably I would say that Pakistan is a young country. 65% of the population is youth. So if it is hitting our youth, so you can imagine how important it is to work on their preventive health in terms of lifestyle medicine. Another issue which is being observed is stunted growth. And initially, when I read the statistics or when I observed, I thought it might be affecting our poor class or people who can't afford to feed their kids. But when I saw that it was prevailing in our affluent class also, so then I started learning about the importance of preconception health, that if the mother is not healthy, how can you expect a child to be holistically healthy? Then a very common occurrence of polycystic ovaries in Pakistan. So these are the major four areas which we observe in our day-to-day practices, uh, coming from all age groups, I would say. These are the different things.
Yeah, that is really interesting. May I ask you quickly about that, the education part? Do you feel that the education, there's just a lack of education, and does that should that come from a public side or from a healthcare side?
Yes, this is from the healthcare side. I think this is the responsibility on the part of government or our healthcare regulatory bodies to emphasize on the importance of preventive health or lifestyle medicine. They are spending loads of money on the, you can say, on building hospitals. They are spending money on importing different or expensive equipment, but probably they are lacking, they are not focusing on the preventive part. So I think that is why I am working more on the awareness part, because
Mm,
the community needs to be aware of the preventive health. They should know how they are supposed to eat. They don't know, they are not aware that they are not sleeping at night. When I tell my patients very confidently, when I take their history, they tell me, no, no, doctor, we are sleeping 7 to 8 hours. When I ask them, do you get up fresh in the morning? Are you ready? Or you are putting your alarm into snooze again and again? They say, no, 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 we can't get up early in the morning. We have to snooze our alarm. So then I tell them that you are not sleeping. So sleep is affected, a very important symptom which is being neglected, and even the population is not aware of that they are not sleeping. So if they
mm.
are not sleeping, how can you expect their immunity to be optimum? So these are the common issues which I observe in my patients also.
Yeah, really interesting. Dr. Tariq, can you share about in India in terms of maybe again similar what the chronic disease kind of situation is, and in terms of the patient working with patients, right? What is it you focus on most, and what's the need also in terms of the patients that you get?
Well, thank you for that question. Yes, of course. It's more or less the same in the entire world, but the burden of certain types of diseases or non-communicable disease essentially more. For that matter, India is known as the diabetes capital of the world, and we're facing basically a double burden: the communicable diseases and the non-communicable disease as well, because the climate and the environment is such that it harbors all kind of diseases in this particular region of the world. So yes, of course, because of the modernization and the acculturation and whatever is happening around, making this world a smaller place, and easily adaptable, privileged, luxurious lifestyles that are adding up to this particular problem of burden of non-communicable diseases. Of course, hypertension, diabetes, as for example, Dr. Shagufta mentioned with regard to the PCOD or the PCOS, that's again been a problem, especially in young females in this part of the world as well, and in fact in this part of the country as well. And we have actually serious concerns with regard to that. And over here as well, these cardiovascular events are very much found in early age as well in young adults, which has become, I mean, obviously a matter of concerns. The other important point that we are facing these days is basically the consumption of trans fatty foods, which are easily available, affordable, accessible. You might not find a whole food easily available at any place in the country, but of course, any kind of packaged foodstuffs, ultra processed foodstuffs, they're easily available with a boom in this food industry. Now, of course, I'm not against it, but the problem over here is what type of food needs to be served to people and at what cost. We need to serve that healthy food availability as well at various places, at community settings, at any other places where you find a lot of people traveling here and there in all such places. So we are facing such kind of issues, which ultimately are causing concerns with regard to physical activity. As I said, the privileged lifestyle, use of everything that is mechanized and motorized, uh, moving on from stairs to the lifts. These all these concerns are basically the cause of the problem. And if we talk about once the disease population is hit on and lands up in the hospitals, people just expect the doctors to prescribe and pop up a pill, and that's how it's the solution is looked at. And most of the time, whenever there is a lifestyle modification or advice being put upon to the other side, being a beneficiary or a patient, there is a lack of compliance in that sense. And most of the time, it's that impatient, I would say, behavior that still is a cause of concern in this part of the world, wherein people expect quick results with quick popping of the pills. So, but then there's a lot of tremendous amount of effort that has been put in health promotional aspects, wherein various agencies, including the government, through its various national health programs, are trying to promote healthy lifestyles, be it through physical activity, be it through nutritional advices at the mass campaigns, at the regional campaigns. So that part is going on concurrently. But we need to match that pace with regard to the unhealthy lifestyles and the healthy lifestyles, right?
Mm.
And in that sense, whenever there is being prescriptions coming in from physicians and all, and the most important point that I mentioned over here is the physician and the patient turnaround time, the contact time between the physician and the patient. That's a major concern that we have, especially in the public sector, because doctors don't have that much of time that they can get into a discussion with the patients and give them a very detailed out information with regard to the lifestyle medicine advices. And the second most important concern is obviously how much they are trained enough to advise with regard to that. Although we have given a lot of recommendations in terms of introducing of the LM component into the medicine undergraduate curriculum, which obviously would be certainly helpful in changing this paradigm of understanding of the allopathic medicine and making it more, I would say, root cause oriented as well, which is very essential rather than simply popping up the pills. Now, with
Mm.
regard to the patient approach and how they are dealing with it, there is at certain pockets, I would say yes, there are at times we have good compliances coming in, wherein people do understand that leaving out certain unhealthy lifestyles is essential to deal with chronic diseases. But if I talk about the major chunk population, it expects that the pill is the only solution for chronic diseases. And
Mm.
this space needs to be kept up so that we make people more aware that yes, healthy lifestyles is one of the important pillars to deal with such situations.
Yeah, we're going to talk in a minute more about the government side and the regulation policies, which I think all of us were thinking about, a lot. Dr. Palmer, how did you do that to bring lifestyle medicine as a modality or a medical modality into the government? Can you share that kind of as a, like a give us the 1, 2, 3 steps to make for everybody else to make that happen?
It wasn't easy though, but it's just that there are policies that are existing in the country already
Mm.
where we can easily inject lifestyle intervention. Like we did not approach the community or the medical societies, the medical industry in general. We did not say that this is a new or a new specialty, a new practice, we told them it's in the guidelines already. We're in the guidelines. Lifestyle intervention is in fact the initial and maintenance intervention for many or most of chronic conditions. And so that's where we came in. And then we just said that there's only a gap because there's no available medical education in the system that's tackling about lifestyle intervention. They already know that healthy lifestyle is there. They just do not know how to put it into prescription and how to give a structured program for us to be called lifestyle intervention. And then from there, we started integrating or introducing the lifestyle medicine competency course, and it really helped a lot that the Philippines is one of the contributors in the lifestyle medicine competencies that's existing right now. And so, having said that, and they thought that there is such kind of validity in what we're talking about. You know what I mean? And then from the existing national policies that talks about health promotion, disease prevention. There's no lifestyle medicine in there, but we use those terminologies to introduce lifestyle medicine. And so that way we were able to intercept and intersect with the universal health care that's currently implemented in the country. And somehow they have adjusted the terminologies because we're using lifestyle medicine already. And so, yeah, we introduced lifestyle medicine as health promotion, health prevention, and we even reverse chronic conditions. And so the way we do it is like we're a friend of everyone. I mean, we're in the middle ground. We're not complementary medicine. We're not alternative medicine, and not just necessarily allopathic medicine, but we are lifestyle medicine. It's the intervention that's provided as initial and maintenance for chronic conditions, and even complementary and alternative medicine. It's the foundation of their management as well. So that way, we became friends to most of the healthcare societies. It's not easy though, but we're also surprised and even overwhelmed because we are undermanned in terms of providing services in lifestyle intervention, specifically education, speaking engagements, because we receive so much invitations right now. The whole country, it's a hype in the country right now that everyone would like to go into lifestyle medicine. And now that's why there's stringent requirements in the Philippines to get into lifestyle medicine certification. It's not as easy as how we get into the IBLM certification. In the country right now, it will take you 2 years to train in lifestyle medicine, and we implement minimum of 2 years, and that's regularly 3 years. So 2 years if you have fellowship training from other societies already. But if you're a general practitioner, this has to go through 3 years of education again, and it's not online education. There's a need for in-person training, hospital-based medical patient encounter, like they go to the hospital and they deal with patients, they deal in the community. So all this community engaged competencies, and then we have injected everything into the competency-based medical education training. So basically, it's the traditional residency training and then the traditional fellowship training. That's what we're doing right now. We're transitioning to traditional residency program. We're also sad because that's going to limit the number of lifestyle medicine practitioners, but the society is also trying to protect the practice so that only competent lifestyle medicine physicians are practicing in the country, because specialists are referring patients to us, like our cardiologists would refer patients to us, neurologists would refer patients to us, and we have to make sure that our doctors are competent whenever their patients are referred to, specifically in the public healthcare system. They've already initiated a lifestyle program, a lifestyle center, and so that we have to streamline competencies and the delivery of training to patients. By the way, I'd like also to share that in the Philippines, among 197 countries, Philippines is number one in terms of breast cancer. Cancer is the second killer in the country. Heart disease is still the first. Diabetes, we are fifth in the Western Pacific region. And then the Philippines has about 100% increment in terms of dialysis. So in fact, dialysis covers the most reimbursement, healthcare reimbursement that we have in the country, and we're so worried about that. And that's where the government is asking, how do we prevent this? Because they're bankrupt. People are into dialysis. These people who are into dialysis were the ones who had diabetes 10 years or 20 years prior.
Expensive.
Yeah, and then
Mhm.
diabetes is still exponentially increasing.
Yeah, wow, this is so interesting, and I think so many others that listen, around the world can really follow and kind of see, how can we implement that here locally in my country, in our country? Now, you made a point that I wanted to ask you. Maybe I ask you right away, Dr. Palmer. My fear is that, as you said, with the 2-year training and the longer process, higher standards, which I'm totally for, right? And I totally agree that is important, but it also limits because the epidemic part of chronic disease is so severe. And my fear is, because I've seen this, let's say 20 years, I'm like 30 years in this field, different levels, so to speak, and the progress is so slow and people suffer so much. And so the question to you would be, what's a better or faster way, not to reduce quality, but to have more availability? Like, for example, Dr. Hyman and others talked about in the US, for example, 100, 200,000 lifestyle medicine practitioners, health coaches are needed to support chronic disease patients, right? To have a bigger impact. What would you say needs to happen to get there?
And that's the reason why we have the basic training in lifestyle medicine that's open to everyone.
Mm,
And that's freely given and that's funded by the government. So that means if you're a primary healthcare physician, they are actually implementing basic lifestyle medicine education. And from there, they will choose who will go through the TEJUS program to become certified lifestyle medicine physician, so that every healthcare facility will have a specialist, in lifestyle medicine. It has something to do with reimbursements, and the accreditation process in the country. So that, because when you call yourself a specialist, there has to be a standardization, and I'm sure that's also true with other country. That's why the basic lifestyle medicine education is offered to all physicians, regardless of your specialization, whether you're a generalist or an internist, pediatrician, OBGYN, So this is implemented for them, not only for physicians, but for allied health professionals as well. And another good thing is that the Philippines is into the implementation of healthy lifestyle, should I say lifestyle medicine 101 for students. And this is from grade school to senior high school. Just 2 weeks ago, before I came here in the United States, I had an interview with the Department of Health and the Department of Education, third party implementer, and they are trying to ask what they can do, with their existing curriculum to help kids learn about healthy lifestyle. And coming from lifestyle medicine expertise, I just said, if they learn English and if they learn math, they have to learn healthy lifestyle. They have to learn healthy cooking. We have to change the food pyramid. We have to change the plate, because
yeah,
the plate, it's meat and fish in we call it the pinggang Pinoy for the Philippines. It's the fish that's representing protein here, and it's the white rice that's representing the supposed whole grain here. We're giving the wrong message to the children, and when they get older, they will be stuck, with those
yeah.
kinds of
It's hard to change then, yeah.
yeah. So that's pretty much how we deal with it. We have the stringent education pathway to become a specialist, but again, lifestyle medicine is now required to everyone, and that's what we're required for primary care physicians that are employed in the government. For private sectors, they're actually catching up as well.
Hmm. Well, that's really good news, and I like what you said, that there's kind of the 101 kind of education first of all, but also for healthcare professionals, so they can somehow implement it, and then it goes up to the specialist. I think that's actually a really good strategy. So, congratulations on that. Dr. Feroz, Would you also dive into that, like in terms of the challenge to really scale? Which again, that's just me. I'm so interested in that because I see the need. This is urgent, right? I don't want to, like in 10 years when I retire or something, I say, we have a few more lifestyle medicine specialists, but still 80% of the population doesn't have access to the support. So, first question: do you feel that the key element in terms of lifestyle medicine is the actual support of a professional, right? Yes or no, so to speak. And then what is it that you see in Pakistan and just overall globally in terms of like that scaling effort? What needs to happen?
Okay. So if you ask me that the priority should be the to target the primary healthcare physician, I would say no. Because for me, every human being who has got little intelligence, who is intelligent, is always interested in their health. So what I did, I think I started this in 2021. I was highly impressed by the idea of WHO, which is now talking about self-care. So what have we have started doing, that we have started targeting the community, professionals, the administration, government administrative officers, and we talk about their self-care. Because I strongly believe in that theory that if the doctor is her or himself is not practicing healthy behavior, will never advocate for a healthy behavior. This is what is I have observed in a family setup also. If mother is not healthy, mother will not be promoting the healthy behavior in the house. If kitchen is not, she is not, will not be taking care of her kitchen, and the family will never be healthy. So as you said that there is so much disease which is prevalent in our on this planet now, so we can't, I believe this, that we have to work on short term ideas, and we should work on something that within few weeks, I would say 4 to 6 weeks, you start giving results in your patient or whoever, community or general public, that they should take the responsibility of their health all by themselves. Because I don't think in my country the government will be able to manage the whole country, such a big country. How do you think that they are going to manage this disease burden? So for me, I absolutely agree with the idea of self care, which is being promoted by WHO. They are promoting this idea because they say that they are short of health care service providers. So that is why they have started promoting self care. So if we include self care at various levels, that will help more. It is so painful to see a hepatologist dying from liver cancer. It is so painful to see a cardiologist having MI. So, physician burnout and self care, these are the two areas which I am targeting because as a human being, we have this innate desire to be healthy. So I'm trying to trigger that innate desire of being healthy. And then it leads to better results as compared to coming to the community from the government policy. So this is what I am doing in my country. By the way,
Mm-hmm.
on a lighter note, I would like to add that lifestyle medicine is now turning into a brand, and a lot of consultants, the last line on their prescription is go and modify your lifestyle. They don't know anything about lifestyle, but they write on their prescription that go and modify your lifestyle. I was attending a conference which was all the deans and I mean the directors of good hospitals were there, and they were very happily talking about. Yes, I promote. I talk about nutrition. The other said I promote exercise. Then I was there. I told them, why are you fragmentizing lifestyle medicine? Lifestyle medicine is not only nutrition, it is not only exercise. And then I asked them, do you know what is lifestyle medicine? They said, no, we don't know. So the need of lifestyle medicine has turned lifestyle medicine into a brand, And probably I would not like to say this, but probably doctors for their better status or promotion will adopt this with a bad intention, so people like you, or I think all of us here, we are interested in decreasing the disease burden. With a very good intention, we are trying to work. So this is what I think about the promotion of lifestyle medicine in my own country.
Really interesting, and yeah, wow. Using the term but not actually knowing what it is and how to apply it is tricky, right?
Yeah,
But I
yeah.
think that's what we're all working on to improve that. So, Dr. Tarek, you want to dive into that too, into that whole question about how to scale? And I mean, India has like how many people? Just a couple of thousand, right? Small country, very small country like Pakistan. So, and the disease burden is obviously huge, right? Chronic disease burden. So, can you share like what you think is needed? And we have just another 10 minutes or so. So, if you could share, and then like a few minutes, and then we have a kind of a summary for everyone to share in a minute.
Certainly. So, with respect to this particular lifestyle modalities and its implementation at a greater good, it requires a healthy environment as well. Yes, of course, when a doctor is prescribing, a healthcare provider is prescribing, okay, you need to do this particular type of physical activity, nutrition related, this, that, all the pillars of lifestyle medicine, whenever they are being prescribed. But certainly, it requires a healthy environment. It requires ergonomics at a workplace. It requires occupational health related concerns. It requires a work life balance. It certainly requires certain other parameters in terms of encouraging physical activity rather than a reductionist approach in which we are taking all these earlier habits that the humankind had in terms of controlling or managing these type of chronic diseases. Now, for example, even if we are prescribing out there physical activity to a certain individual, yes, of course, there are certain places indoors as well. This can be done at their homes and everything at any other place. But to bring a community together and make it as a lifestyle of a nation, of a region, it essentially requires a background healthy environment. For example, essentially presence of open parks, open gyms, in that sense, which encourages, basically there needs to be a cult of positive lifestyle being inducted through a school curriculum as well. I'm not talking only about the medicine curriculum, but such kind of lifestyle, healthy lifestyle habits that should be inculcated right from the inception of the education per se, right? And which would include the physical activity, which would include what to eat, what not to eat, what is a healthy meal. And as like Michelle was also mentioning, there is something that is pictorially shown to the students, which is entirely different from a healthy nutrition that should be actually being consumed by the general population. So for that matter, a healthy environment is essential. For that matter, educating them, like putting up posters, like how many steps, like there was a concept in one particular conference that I was attending in UK, and wherein they were showing pictorially of converting a prison into an healthy environment, right? And for that matter, the steps that as the steps went up, the number of calories that were consumed while going up was marked over there. So quantifying it, making it more measurable. Now, in terms of work-life balance, there are certain parts of the country or certain regions of the world wherein emotionally taxing type of work is encouraged. Mostly in the South Asian population, there is this problem with regard to too much of work is actually your shows you are much more a good worker. You're at a higher performance at the cost of the stress onset, at the cost of your health. That is a big problem that we are facing down here in the South Asian side as well. So these particular, I would say, occupational health related stances. Then, for example, if we talk about community kitchens, if we talk about even in the hospitals, the canteens that are run, what kind of food is being served over there. Those are those regions where we need to take up in this particular manner, wherein healthy nutrition is being kind offered to the healthcare providers, to the patients, or for that matter, any other working workplace wherein these particular risk factors are easily exposed. If we talk about onset of cancers as well, the way we are having our lifestyles, consumption of foodstuffs, so much of genetically modified foodstuffs that are being easily rolled out, and all the other use of utensils that is of a concern. Plastic is one of the primary concern in this part of the world as well. So much of availability of free plastics, easily available packaged foodstuffs, all down there in different forms uh, I would say, materials that are crude, carcinogenic to a great extent. So these particular factors, I think, need to be addressed at the mass scale, and obviously at the regional and or at the institutional levels, we need to adopt such policies, which we've been talking about the pillars of lifestyle medicine
Mm.
at all full length and breadth. Essentially, it's very important that every institution, every university that is related to, especially to the medical side as well, do have a lifestyle medicine department rolling out, where they take initiatives in educating the healthcare providers, educating not only the healthcare providers, but do some kind of a research as well to build more evidence-based medicine in terms of lifestyle, which would certainly help in understanding the evolution of all these diseases that have taken a huge toll on the entire population in the entire world. So
Mm.
I seriously think that it's a matter of concern these days, with a rising burden of all types of non-communicable diseases, including cancers. And I obviously see lifestyle medicine or lifestyle modifications as one of the solutions, not only to the chronic diseases, but to the communicable diseases as well. Thank you.
Right, right, absolutely, absolutely. And the social component of chronic disease obviously is something we haven't even talked about, but we have a couple of minutes for everyone. Um, I did this in another panel earlier, I think day 2 or 3, and I said, magic wand. I have a magic wand for you, right? What's the one thing in your country that I think you believe needs to change to grow and scale lifestyle medicine in a huge way? And it could be the reimbursement, it could be the education, it could be government supporting it, whatever it is, right? Having a vision as a country. What is it you feel would be the most effective way to really scale and have more access to lifestyle medicine? Whoever wants to jump in.
I'd
For
like to
my
go.
country, for my country, I think awareness primarily, because we have 60% youth who is addicted to social media. So we can use this addiction for positive change by giving them message about their health. So my country, awareness comes first, then will be education. And I believe this happened in US as well, that the population changed the government. So this is what I'm trying to target in my country.
Very good point. Education. And like I often say, we need to make lifestyle medicine more sexier, meaning
Yeah,
like more, hey, this is exciting. Tell me more, right?
yeah,
So
yeah.
yeah, great point. Great point. Dr. Palma?
Yeah, I would say in my country, what's working right now is the policies in place. And it's already tested and proven. There's a blueprint of population based study in North Korea. It's the only study that changed the trajectory of non communicable diseases. And so that's what we're trying to emulate in the country. It was presented by the Department of Health in my country that, hey, this North Korea was able to do it. It's hard, it's not easy, but if the government will put the policy and law, for food, then of course all people will be aware. So if there's a policy, I mean, there's a sin tax already for our in our country. There are cities in our country where smoking is not allowed anymore, particularly my city. So our city is now branded as the wellness center for in the Philippines, and it's slowly picking up. So, and one more thing, if I would I want to say is the reimbursement, because doctors will pay attention, will give and provide the service as long as this is reimbursed.
Yep, seems to be a common theme. Reimbursement. Excellent. Dr. Derek, you want to close it out?
Yes, I would reckon the same thing, that if a magic wand is required to bring in a lifestyle change, that would be through education and primary education, actually, because the younger generation that is coming in is going to be the future of any particular nation. And for that matter, inductment of a lifestyle medicine, not for that matter lifestyle medicine, but lifestyle education, healthy lifestyle education should be inducted in schools. There should be creation of healthy environments. And I would also go to the extent that certain stringent policy should be there for any kind of trans fatty foods that are being easily promoted. And for that matter, even WHO or certain other organizations do recommend putting up heavy taxes in terms of trans fatty foods. So those particular things are essentially required. And then, of course, the lifestyle medicine education at institutional levels, university levels, and especially to the healthcare providers.
Hmm. Wonderful, wonderful. Thank you so much, everyone. Maybe I just kind of share my 5 cents, whether it's worth it. I think globally we need to have a 1% a rule that governments invest 1%, which is really small, right? 1% in ending the chronic disease epidemic. And that money goes towards reimbursing lifestyle medicine practitioners and practitioners that are trained health coaching, for example. I think to me, and then Dr. Katz, Dr. Yamani, Dr. Pearl, and so many others in the summit talked about that. At the end, if you really break it down, it's about incentives. So I think we need that global incentive, and then I think we're going to have that wildfire. So I'm going to say it as often as I can. Hopefully someone is listening. Thank you so much. Really appreciate it. Thank you for being here, for sharing your story and your work, which is absolutely amazing. Thank you again, and hope we can maybe join some of our podcasts at some point, or have you back next year for the Lifestyle Medicine Summit. Thank you so much.
Thank you.
Thank you. So we're going to be back in about 4 or 5 minutes. We're setting up the next panel, which is about the MENA region, Arab-speaking countries. Lots of exciting developments happening there. And so please come back in about 4 or 5 minutes, and we talk about like the experience in these regions. Thank you. See you back in a minute. Hello and welcome back to our day 7 international panels. Right now, specifically with lifestyle medicine specialists, experts in the MENA region, which is basically in the Arab-speaking countries, Egypt, Saudi Arabia, and other countries, UAE, and so on. And it's really, really interesting what's happening there and how lifestyle medicine finds its way into healthcare. So I'd like to welcome our speakers, Dr. Nesrin Al-Hamidi and Dr. Rayan Abdul Wahid. Welcome. Nice to have you here.
Hello, Dr. Johannes. Nice to be
Hi.
here.
Hi, how
Thank
are
you so much. Yeah, thank you. Thank you. I hope you're well. Thanks for taking the time. I know you're very busy with your work. Let me introduce you. So Dr. Nesrin Al-Hamidi is a family physician, lifestyle medicine, women well-being consultant in Saudi Arabia, and really instrumental in this new movement in terms of wellness and holistic wellness, lifestyle medicine. And Dr. Rajan Abdul Wahid is a holistic wellness coach and health tech entrepreneur, and also one of the leaders in this field. So before we start, I just want to say that Dr. Reham couldn't make it. She's stuck in an airplane. So unfortunately can't be here, but that's okay. We're going to be fine, right?
Absolutely.
So,
Yeah, sure.
so again, welcome. What I'd like to do, if you could introduce our audience worldwide, like what's the status right now in terms of the chronic disease epidemic and lifestyle medicine, wellness, kind of finding its way more in a bigger general public. And I was in Saudi Arabia and Dubai, in Qatar, like last February, March. It was great. It was wonderful, wonderful. And one thing I was so surprised and so excited about is the excitement about the Vision 2030. I know you're going to talk about that, and this drive that the government actually supports wellness and health, which I think is really exciting, having a vision. So in any case, Dr. Nesrin, you want to start and kind of dive into that aspect?
Yeah. So let me share the slides.
Mm-hmm.
Actually, thank you, Dr. Johannes, for inviting us in this great conference. And inshallah, we're going to share with you some steps from the 2030 vision related to wellness. Because as you know, as Arabic panel, we introduced in Saudi Arabia here, we have a lot of a huge percentage of diabetic patient, obese patient, hypertensive, chronic disease in general, as worldwide. And this is absolutely related to our lifestyle and all these issues. So just gonna take a look about the 2030 vision with you and then share some steps related to wellness and how we can take the benefit from this vision to serve our wellness in the future. Actually, the health sector transformation program was targeting to shift from focusing on activity-based to outcome-based. So it's the most important how to, and it was clearly addressed in the vision outcome to decrease the obesity patient, diabetic patient, all chronic disease as much as we can in 2030, inshallah. Population health management also, and provide accountability, increasing autonomous, and we're going to explain to you how this comes. Actually, the model of care has changed now, and it's targeting the whole layers of care instead of only therapeutic. So we're starting from well-being and socially and reaching the community in their home to as much as we can supporting the well-being. Mental well-being also by education, awareness in social media, in education material in the schools and also in universities. Physical well-being, and they are now starting to put a walking area in each part of the city. So it is a must now to have a walking area in each part. Also, in healthy communities, activated person. This person, his job going from primary care to the houses and try to give the education related healthy food and healthy physical activity. They have any social or mental issue, they can interfere. And then primary care. So primary care, it was the first line, now it's the third line after reaching the community in their homes. And primary care, we're applying as much as we can the lifestyle pillars all. Plus, if we have a chronic disease, we're going to interfere from the beginning as a screening and as education also. And general hospital care and specialized hospital care in the sixth layer in the treatment and in the care, model care to provide to patients. And as you are seeing here, the model care also involved the whole sectors, not only governmental, it's also including the private and third party, as we are calling them, the private sector, workforce, the conversation, purchasing programs, all these together to provide this type of model of care. And maybe Dr. Rayyan is gonna give us clue regarding the role of private care, private sector to support this wellness in the community. Clusters now, as you know, in Saudi Arabia we have Western, Eastern. It's a huge, mashallah, population. So what they did, they just divided the Saudi Arabia to have same standardized care from all layers in the community, starting from preventive services up to therapeutic. And this is, as you know now, we are in the virtual.
Let's
Do you
see.
hear me?
Here we go.
Do you hear me?
Yes. Yes.
Oh, yeah. So what I was talking about, Saha Virtual Hospital, this is the biggest virtual hospital in Saudi Arabia. And this is the duty of this hospital to provide the virtual care to the patient in their home, starting from preventive services. Even in smoking, they have hotline 24 hours over 24 hours. In mental health also, you can reach them any time regarding the dietary advices, physical activity, elderly people, women, breastfeeding, child, all these can reach this hospital anytime, and they can providing the virtual services, even surgery and medication and all these, they can do it as communicate with the patient virtually. Some rules and regulations to promote healthy lifestyle recently was addressed by tax and Zakah ministry. Regarding tobacco products, with all products, they are now applying the excise tax of smoking for 100%. So, for example, if the packet of cigarettes is 10 riyal, now it's 20. So it's the 100 increase. In sweetened beverage, soft drinks, all these, now it's become applying excise tax of 50%. So it's increasing the price of the sweetened beverage. And it's somehow, I know, but these regulations can help sometimes, and the cost become more, encouraging population to think again about smoking and all these things. I just want to share with you a sample of lifestyle clinic approach, what we are applying here. In Saudi Arabia as a polyclinic of lifestyle clinic. When we have a patient obese, for example, or smoker, or have any lifestyle issue. So we can start with these patients passing through many stations. So station number 1, it's family medicine and lifestyle coaching station. So this is first one, just to see the patient's what's the background of the patient, what the goal, and all the coaching map that they're gonna show it to you. They were gonna refer to fitness coach station and clinical nutrition, and also mental health. And if we need, we're gonna refer the patient to subspecialty to have a care from endocrine, for example, surgery, sleep medicine, whatever. If they have an issue, need this care. In lifestyle station, we are providing coaching session. So, for example, if we have this lady, she's 46, and this is a real case, by the way. She's 46-year-old female. She's academic staff working in university, a mother of 2 boys, living with her husband and son at very good socioeconomic status. She's physically inactive, and she's the known case of dyslipidemia and hypertension, taking medications like hypotensive statin and calcium channel blocker since last 2 years. When she come to our clinic, her weight was 140 kg and her height is 161 cm. Her BMI was 54%, so she was a morbid obesity. And the blood pressure was 141 over 85. Her LDL was 189.62, it was high, and her HDL was low at 41 milligram per deciliter. Triglyceride was 200.9 milligram per deciliter, and A1C fasting blood sugar was normal. So what we are providing to this lady, she was passing by all stations in family medicine lifestyle coaching station first. Assessment was done for her for waist circumference, body composition measurements, received the stress scale. Please. Are you hearing me?
Yes, yes. She's back in 1 second. Dr. Rajan, I'm going to have a question, and I come to you in a second, okay? Once we have a couple of questions that I want to ask while they're in my mind. Go ahead, please. Go ahead. Ms. Ren.
Okay, so assessment was done for her for all measurements, and 3 days diary was done also, just to know what she's eating from she's walking till night. I perceive stress scale. This is really very valid tool, and it's very practical for knowing the mental health of the patient. And then coaching map was done for her, starting from the long-term goal, short-term goal, and the plans. After many sessions for 6 months, her readings become approximately it's become normalized. For weight still, it's 116 kg. So her BMI now is 44 instead of 54. So she's still not normal BMI after 6 months. But this 17% decrease in weight, reflecting on her readings for LDL, can become 131. It was 189. Her HDL still 142. Triglyceride is 91. It was 200. And her blood pressure become 125 over 75 without medication. She was off medication of hypertension. So this is one case just I want to share it with you, and the new 2030 vision regulations and model of care that is reaching the patient in their home even before they become a patient. And this is our target as a lifestyle.
Well, I'm so impressed, because basically it seems like Saudi Arabia here, it did what most of our speakers said needs to happen, which I guess is have a vision.
Yeah.
Important, right? Otherwise nothing's going to change.
Yes.
Actually put the money where the goal is, really, right? Investing into well-being, which is part of that vision. The simple setup, I mean, it seems like amazing, right? In terms of clients, first of all, the virtual, use that.
Exactly.
Absolutely great. The stations where they go from one set to another, and having the support. Can I ask you, is that kind of not implemented all over the place, right? But in some clinics, or is it like really spreading everywhere right now?
Actually, as I explained in this model, in all these stations, no, it's not on all places. It's just by some governmental hospitals, some private sectors. But inshallah, with all this support, we are wishing to be applied as standardized care in all hospitals, because this is our goal, to standardize the care. The patient will go anywhere, they are going to have same care.
Wow, wonderful, wonderful. Thank you so much. That was super enlightening. Dr. Rajan, what's your take on that? More on the private sector, as we were saying. Give us a background, how that works, and maybe also your journey. Why you went to the private sector, working in traditional medicine before, I believe. So let us know.
Absolutely. Thank you, Dr. Johannes, and thank you, Dr. Nasreen. Yeah, I used to work in a hospital setting for many years. And being a dentist, I was dealing with clients or patients face-to-face, one-on-one. And I used to really see a lot of lifestyle issues. You know, a patient will come in the clinic for, say, a toothache, tooth pain, you know, any dental issues. But when I would look at them and really assess them, I would see a lot of other issues. You know, you can see they're overweight. They have poor breathing habits. They have, obvious stress. You know, as dentists, we can see signs of stress on the teeth, as bruxism or clenching. So just sitting there, I had a very unique vantage point of what these patients are dealing with and what they're tackling. So it always seemed like they were tackling, the results of their poor lifestyles. So that slowly made me kind of pull myself outside of that system, because I really wanted to help patients, look at their lives from a bigger vantage point, to look at their lives holistically. And that type of conversation is very difficult to have in a clinical setting, inside of a hospital where the system is very different. Even the client's mentality, when they come into such a, an environment, they're not ready to be coached. They're not ready to be, really assessed in a very, let's say, in depth, looking at everything in their lives and questioning, things and going through, maybe difficult questions and challenging, lifestyle changes. So that's why I slowly pulled myself out of that system and started working with clients in the private sector. And we started our own center where we look at clients holistically. So when a client comes in, we really want to dive deep into their daily habits. So we love to use health tech. So we use wearable tech, we use fitness trackers, sleep trackers, CGMs, continuous glucose monitors. And we take all this data and we start tackling a client's lifestyle day by day. So we're trying to prevent, for example, the patient that Dr. Nasreen was sharing. She already reached, certain illnesses that we want to avoid. Having those high numbers, being at that age and trying to, make lifestyle changes, it's quite challenging. At a certain age, behaviors become even harder and harder to tackle. So we primarily focus on maybe younger people and trying to make them aware of the prevention aspect of wellness. So we really want to catch things early. And a big part of what we do is educational, for sure, because clients come in not understanding that all these pillars are actually quite important. When you're young and you feel good, you get sick one day, you sleep, you wake up, it's gone. But the things that are being repetitive on a daily basis, especially these poor habits, they do compound and they do eventually turn into symptoms, and those symptoms eventually become diseases, and it becomes quite hard, to really, move their trajectory in life. So yeah, so we combine wearable tech, we do certain assessments, and then we do coaching. So we sit down with the client and we watch their sleep. So that's one pillar, recovery and sleep. We look at their REM sleep, their deep sleep, their sleep patterns. Are they changing from day to day? Is it the same in the weekend compared to the work days? We talk about things like social jet lag, which is a concept that they need to also learn and understand. And that alone can, we can spend many sessions just tackling sleep. A big thing in our culture in Saudi Arabia, we are big caffeine and coffee drinkers. So coffee, tea is something that is nonstop. It's very cultural. It's very, it's ingrained in us. And unfortunately, a lot of people don't realize the big impact that's having on many aspects of their wellness. I'm happy to talk in more detail, but I would love to hear if you have any questions, Dr. Johannes, and I'm happy to share.
Yeah, actually, that's funny that you mentioned that, because that was kind of like one of my next questions. The cultural aspect of lifestyle medicine, lifestyle, right? Which is a lot of people don't realize, especially if they haven't traveled much, how huge the differences are. So talk to me about the challenges you see, if it's in a clinical setting or private, in terms of the lifestyle improvements. What are the biggest challenges, the biggest beliefs people have, and what's the cultural aspect?
Yes, absolutely. These are some of the most, let's say, uncomfortable conversations we have with some clients, because you're trying to change generations of habits. So when I tell a client, the coffee and dates, they eat, a client could easily eat 5 dates in one setting, and that just spikes their sugar tremendously. So when I tell them that habit that they usually do with their families at night, after a stressful day at work, is actually causing them issues. And to them, they're like, you want me to stop spending quality time with my mother, with my father? And it's actually an issue, because that's where they bond. That's where a lot of us bond, me and myself as well.
Exactly.
So, at the end of the day, you finished work, you go, you sit with your mom, your dad, your brothers, and there's always dates and coffee. And it's nonstop. And to me, this combo is quite dangerous. You have the spike of the glucose and then the crash. And with that, your heart rate goes up, and the caffeine takes your heart rate even higher. And it really disrupts a lot of things, whether it's your sleep or your mental health or whatever. So having that conversation is very difficult, but my favorite thing is showing them the data. I'm a very visual person, and what you measure, you can improve. So I show them their blood glucose, and I show them the effect of their caffeine on their sleep, and I show them the patterns. And when they sit there and they view their habits and let's say the consequence of their habits in front of them, it actually sparks a little bit of, a chance to make a behavioral change. So I would say that this is one of the core, cultural habits that need to be tackled and understood, and maybe redesigned in a way that we still maintain, our cultural values and quality time, because that's also a pillar of health,
Yes.
Spending quality time with the people you love.
Exactly.
Really powerful. Dr. Nisrin, what do you say about that same situation, the question, the cultural belief kind of an impact, and the challenges to make actually these lifestyle changes?
Actually, yeah, it's something challenging every day and in every patient. Because when we talk with the patient and tell them smoking is not good for you, you have to move, healthy food, all this they know totally what's the harms, what the benefit. They even can tell me more than I know. But why they are not doing what they know about, this is coaching about. So this is here the habits and power of habits become. And I agree totally with Dr. Rayyan. It's here in our culture, and I'm sure it's in different cultures also have the same. We have social feeding or social eating. So we are gathered together, celebrating for something, we are eating. If we're happy about something, we are eating. If you are sad, we are eating. So it's food always our friend. So what we try to tell to our patient that it's just a habit. So we can celebrate and we do something else, and we can use better type of food, for example. So we try to adjust as much as we can, because this is really something since long time. And there is something beautiful about habits. When I explain to my patient, I draw to them the habit, and I tell them there is a trigger and there is a reward. Every habit we are doing, we have a reward come to us. So just let us to write together one habit. For example, if you have a stress and you go to eat, you are doing this unconsciously, because you are just have a stress, immediately go to fridge and open the fridge and take something sweet and eat. So we try to draw together what's the trigger. And once you realize that now you have a stress, what's the reward come when you eat? You're just distracting yourself. You're just feeling good. You're just having this very temporary pleasure. So let's have same reward with different behavior. So I'm just asking the next question, what you can do to deal with this stress and having same reward. And you can imagine how many solutions they are giving me, how many behaviors they are giving me. So just we can try to sit with our patient in coaching session and try to write it down the habits and see what the reward they are searching for and what the trigger they are making them do this habit, and try to act on habits one by one. It really helped me.
You know, both of you are so experienced, and I think you study with us at the university, Life Subscription University, because it's exactly what we say. Meaning that, and that's actually a question, right? If we know a habit means it's habitual, it's not a conscious choice in many ways. The body runs the system that process that habit, right? And then talking to them in terms of information, giving more information, that's important to a certain degree, but at the end, the real change happens in the unconscious part, in the biology. Would you agree? And when did you realize that it's like the way we talk to our patients is making huge difference?
Yes.
Whoever wants to jump in, let's just mix it up.
I would love to jump in here. Absolutely. You know, I've realized one core difference between the relationship with a patient inside, you know, the clinical setting, and then a relationship with a client in this coaching like session, is the time we take in conversation, you know, the time we take talking to each other. And that really gives you the signs of, you know, where the triggers are. And you can see the more they express, the more they share, what aspects of their lives are actually, you know, maybe the causative agent. What is causing this reaction of, you know, a lot of conditioning, many, many years of conditioning. And then as a coach, as someone who has to be a very good listener and, you know, trying to catch all these patterns, you'll be like, okay, let's dive deeper in that point. And you start, you know, slowly deciphering the code, and you realize, okay, like 1 + 1 = 2, and that's what's been happening. And you just look at that, you know, stream of, situation, input, reaction, and you start showing the client that, just like Dr. Nasreen said, you can draw it, you know, kind of let them visualize it, and then understand where to put your energy.
Dr. Nasreen, you want to dive in?
Actually, I totally agree. It's the coaching. Because of that, it was a challenge, because as a physician, you have to sit with the patient for a long time and take this sitting, try to talk about his background, what he, usually I'm starting with the patient to tell him, just tell me as a story. When you're woken till you sleep, what you are doing. So when he's talking about all this, I try to know, I start to understand where's the issues. As Dr. Ryan said, because when the patient talk and as a story, when I woke up, I doing like this, so I know when he's starting to take his breakfast, what is his things that he like to eat. Usually when he sleep, if you have to take long nap, if you have stressful work, if his family is supported, he will gonna talk. So during this talk, we can just draw together. I'm just writing down some points, so I can show it to the patient and share to the patient that when you are talking about this, I feel your voice tone, for example, become low. I feel you slow down in this point. I feel this something is really bothering you. So watching patient, even physical language is more helpful, even about what he's talking about.
Yeah, powerful. But would you say it requires listening? Meaning it requires for you, basically what you just explained, I mean, you have to pay attention, really be present with the
Exactly.
client, right? Is that a
Exactly.
big skill?
Yes, for me, it's take a year. It's take a year because as a female, we like to talk and details. We like to talk about details, and when he's talking about something, I jump to the question, and this is not the way. So it was a long time training for me. I was trained even with myself to listen without even asking any question. To be present with the patient, to see his physical language when he become really happy about something, sad about something. It's not easy at all. But we were still training till now. Yeah, now it's more than 5 years in coaching, and still till now, I have moments that I want to share, I want to talk, I want to comment, but it's become better with time. I feel it's with training to become better, inshallah.
Yeah, and it's I just love it just listening to you, right? You just are so experienced and so well trained that you know exactly how to deal with that situation. So it's just wonderful to hear. So congratulations. It's like
Thank you.
good. Which is great, and I think that's what training needs to be. And again, not so much about information, but implementation. And implementation
Yes,
is on a biological level and not up here for most people,
exactly.
right? So, Dr. Raja, what would you say? What's your experience in terms of the listening part, and what are these skills that you found help clients or patients to make these habit changes more easily than not?
Yeah, absolutely. I agree with everything Dr. Nasreen said. And I think the main difference between a wellness coach and a, let's say, physician is time spent listening. Recently I had a doctor's appointment, haven't had one in a very long time. And I just started talking, and the doctor was like, "Oh, we have 5 minutes left." I was like, "What?" I have a lot to tell you. I was prepared. I had things written down. I had concerns, and we only were allowed 15 to 20 minutes. And within
Yes,
those 15, 20 minutes, he had to write me a prescription and, do some things on his computer. So that is a huge aspect of understanding the human in front of you, you
Yeah.
know. And I think, it's not the doctor's fault. It's the fault of the system. It's a faulty
Good
system.
yes,
system, right?
Exactly. It's that if this doctor was given an hour for each patient, I think he would be absolutely happy. And then training physicians or training people to be coaches more than physicians is a big skill that a lot of people I don't think are understanding the 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 weight of it. Skills like listening and being comfortable with silence, and then asking the correct questions to pull more information instead of giving your advice, are
Mm,
skills that unfortunately you have to learn outside of medical school.
yeah. Well, that's, I think, a lot of, I
yes,
say, really good health coach trainings are like that, right? That's where you learn that. We're calling it conscious question, right? Not just providing information, but what's the question, and that actually helps the client to self-realize, where it just pops up and they start to realize, and oh, maybe I can do this habit, practice that habit. And they do it because we didn't tell them.
Yeah.
yeah,
Right? I mean, for example, one thing
exactly.
in terms of government, I always give this example. Like in Germany, for example, they the government says, the Green Party, meat is bad for you, so we have a rule now that we want people to eat less meat. And you know what most people did here? I said, you can tell me that. I do what I want, right? And I think that's the thing, when clients then feel this themselves and they have the data maybe and have great coaches like you guys are, or practitioners, it just makes a huge difference. But let me ask you something else, because I can talk with you about that because you get the inside scoop from a healthcare professional side and a coaching side. Because like my vision is, as you probably know by now, like lifestyle medicine, health coaching accessible for everybody, which means we have to scale, right? And not like in 20 years or 50 years, we say, oh, now we have it, enough people have access, the ones that need it. So my point is, do you think physicians, the position of physicians could be that of writing a prescription? They have maybe 10, 15 minutes, and I think that's not going to change that much, let's be honest, because we can afford physicians to get paid double, triple, 5 times in terms of time, right? It's just not going to happen, I think. So what if the physician has the position of, here's my traditional medicine prescription, pharma and so on, pills, and here's my lifestyle prescription. That's why we chose that name, right, for a university, because I think that's the only option, I think, or one of the few that are actually going to make a difference, where a physician can easily learn the basics of lifestyle medicine, but then they use their prescription pad. Do you think that would be powerful, that if a physician says, well, I'm sorry, I don't have the time, here's a prescription, you talk a little bit and make sure they actually like that path. Now you provide an option, right? And then they send them to you, or as a coach or as a practitioner that is trained in that. Do you think that would be something that would work, also specifically in Saudi Arabia, to scale more, faster?
Yeah, actually, what I'm doing in my clinic, like this, so I tell the patient, I have 2 options for you. We can have this path and have this path. This one, it's need time, need commitment, need to have regular sessions, changing habits, all these sessions. And the other path, it's easy, it's short time, it just give you a prescription and you can just go for 5-10 minutes and that's it. So, and explain to them the consequences of both. So if you have a lifestyle modification, habits and all this, you can even reversing your chronic disease. You can even prevent to have a chronic disease, even in your genetics have a chronic disease. Instead of the other path, it's just controlling the disease, just waiting for this to happen with these habits and preventing complications or delaying complications for a while. And let them choose, because this is really, when the patient seeing this and this, they are become encouraging to go with this path.
Would you say, just a follow-up question, that, or what's the percentage, if you have this, like, okay, you can go this path, you can that path, and you kind of, I think it's okay to also, like, the side effects on this one are like that, and then here you have a typically positive side effects, right? What's the percentage of clients, patients then choosing? Which percentage to choose the lifestyle path versus the more traditional path?
Actually, when choosing lifestyle path, I have no specific percent, but I can give you from 10 patients, 6 to 7 can go with lifestyle, and 3 up to 4 we're gonna go with the other path. But most of them actually they're choosing lifestyle.
And for both of you, what do you think is that key element that they actually choose the prevent, reduce, reverse chronic disease versus manage it? What's in people's minds or bodies what makes the difference? And by the way, guys, I can talk to you with this about these things because you do it, right? And you do it in a perfect way. So thank you. I mean, everybody can learn so much from you. Thank you so much, in a practical way, right? Pragmatic way. So what do you think? What's the difference?
Yeah, I can add here. I would say, it is going back to the conversation you have with the patient, with the clients, spending time educating them and making sure they really understand the different paths. So we have the therapeutic path and we have the lifestyle path. I think when they truly can envision each path and how their life will look like maybe 10 years down the line, 20 years down the line, and when we have this idea of health span, the client or the patient now understands what this term means, and they understand what this path will lead and how their lives are going to be in 20, 30 years, and how the habitual one, which takes more time to get used to and see the results, but what their life is going to look like after 20, 30 years. So spending time with them, helping them envision what life will look like in the future, really has a big effect. Because, if you just tell, one of the things I do with clients, I tell them, do you have kids? Someone would say, yeah, I have a kid. I'd say, how old is this kid? Be like, okay, he's maybe 5 years old. I'm like, okay, when 20 years from today, how old will you be, and how old will your son be? And what do you want to be doing with this son? And a lot of them say, I want to go travel, I want to hike, I want to do all these things. But they don't realize that what they're doing today isn't really going to help them reach that desire. So once they know the difference between, the invasive route, the therapeutic route, and, the traditional route, and then the lifestyle route, I think it really helps them kind of make some, important decisions in which path to take.
How true is that? How true is that? My God. Wow. I'm impressed, guys. I'm so impressed. And I think maybe, let me say it this way. What do you think is the impact of the Vision 2030? Would all this have happened? And I don't know when it started. I think it's 10 years ago or 8 years ago or something, right? Would any of this have started without that Vision 2030, which is all about well-being for people, the country's people?
Mm-hmm. I believe the Vision 2030 really sparked a fire under everyone. Everyone started, making moves, whether it's in, the traditional sector, the governmental sector, or in the private sector. Everyone now had the vision, it's in the name, Vision 2030. Everyone started having that, futuristic vision of what life will be like, and what kind of life maybe their children are going to be experiencing here in Saudi. So that really lit a fire under all of us. And I think it really made a big, jump in our understanding of health and wellness. There's a lot to still improve, but we're headed in the right direction. And I truly believe in building by iterating. So as long as we're moving and we're learning from our actions and going through that iteration cycle, I think we're headed in a really great direction.
Absolutely. And then your technology and skills, I think, going to improve. I always say that's my firm belief that lifestyle medicine also needs to improve, right? I think there's so much room to grow. We have a foundation now, but I think all of our skills we can improve to be more effective, health outcomes focused, and improve more. So I think we're just at the very beginning of this whole process, really, even from our skill sets, basically. But Minister, you want to, let's maybe, we have just about 5 more minutes. Do you want a kind of closing statement where you see this is going, and kind of give me an inspirational message for all the physicians and healthcare providers that are in Saudi Arabia, and all the MENA region is so huge, right? I mean, so many countries and Arab-speaking countries, and not just around the world, really. What is it you feel needs to happen? Why even you doing this? Why you are doing this versus being a traditional doctor? Why would you like them to actually think about adding lifestyle medicine or switching into lifestyle medicine?
Okay, that's a great question. Actually, what makes me every morning go to my clinic with all this passion to seeing these miracles. When I experience, I think my message to all my colleagues and physicians, you have to experience to seeing the magic of lifestyle. You have to see the transformation of your patient life, even socially, mentally, physically, everything in their life is changing once they start to change their habits. It's powerful, and it's make you as a physician feel good and feel you are doing your job. As we are physicians, we're just prescribing medications and tell the patient you will gonna have nephropathy after how many years, and you're gonna have retinopathy after 1 year. Just watching for complication to happen in chronic disease, instead of doing a real job and seeing this miracles happened, and your patient becomes 60 and 70 and 80 without a disease, and they can walk without assistance. They can live a quality of life. They are deserving to have this quality of life. And you're a physician, you can help. You can help. Your role is beyond prescribing medication. So just try, just do it. Try to improve yourself. Try to have this even coaching course, whatever, try from this great conference. And we really, really thank you, Dr. Johannes, to spotlight on this field, because all physicians, if they hear all these topics was discussed in these great days, they will at least they have this mindset of health and wellness instead of disease mindsets.
Powerful. Thank you so much. Dr. Rajan, like what you would say, what inspires physicians? What's your passion? Why are you doing this? And how can others maybe feel the same?
Dr. Johannes, I think, a lot of physicians these days and, coaches, they all understand, the power of this path, the lifestyle medicine path. And a lot of people, even though they weren't trained this way, they were trained in the traditional way, they know that it has a very high impact. I believe it just takes some courage. A lot of physicians, people in the health sector just need to make the change, try to get out of this old system. It's going to be uncomfortable. Try to develop these new skills, like through, platforms like this, and start making, the change on a country level, because the country is really giving us the facade, the canvas. The country is really building and providing all the resources. Now it just takes courage from the professionals to start making the changes, even if it's a bit uncomfortable in the beginning. I think building a new system together is very important.
Wonderful. And do you feel there is is it all or nothing, or is there a way to ease into this? Meaning that someone has a successful practice, they may be afraid, well, what if I use that? Patients might not like it, or there's a revenue change, or whatever thoughts and fears you have, right? Is there a way to integrate lifestyle medicine more in a softer, simpler way, and then grow into that to get trained more and learn more, and then maybe switch even more, maybe hire a health coach, or however that's going to work out?
Absolutely. I believe the change and the healthy transition is already happening as we speak. And I think it's just teamwork. We need to collaborate. Someone who has an already, well-established clinic or center, all they need to do is kind of add certain elements to their current practice. Maybe collaborate with other health coaches, maybe onboard certain professionals within their clinics. So I think it's just a merging of two worlds coming together. There are people still in the very extremes, but I think this merging is happening, and we're going to be supporting each other.
Dr. Nisrin, last words.
About lifestyle, never finish talking, but usually I have this word to the student, medical student, who's still in the beginning of your learning and your journey. So as much as you can, even if your medical school not offering you lifestyle medicine, education, coaching, try to go by yourself and take it, because this is, if it's starting from the beginning, you're going to grow up with this health mindset. And wellness and health mindset is really going to help you when you start your career, and when you're going to workplace, you have many mindset with wellness. This will gonna have a huge generation with this wellness mindset instead of disease mindset. And yeah.
Thank you so much. That was superb. Like you sharing your experience in the daily work, the pragmatic way of using lifestyle medicine with patients, seeing the results, the outcomes, right? Obviously that's everybody gets excited about that, because you're actually helping people really to reverse, not just manage for ongoing endless times, and so thanks again so much. Really appreciate it. Again, maybe we can put you also on a podcast over the next month, throughout the year, and talk more about that, because I think people need to hear that, healthcare professionals especially, that it's actually more fun, less burnout, and I think more fulfilling, So thank you again.
Thank you so much. Really, thank you to have
Thank
us.
you. Thank you so much.
Thank you very much. Take care.
Thank you, thank you. So let's see, we're gonna be back in about 7, 8 minutes with our next presentation, our next panel, which is about Turkey and not so much the healthcare side of things, but more the private sector and how the private sector actually can play a big role in improving lifestyle habits and so on. So I explained it in a second. See you back in about 7 or so minutes. Here we go. Hello, welcome back. Last day of the Lifestyle Medicine Summit 2024, international panels exploring, how different countries, cultures use and integrate lifestyle medicine. And so I'm so grateful. The previous talk or panel was just amazing. This is going to be even better here. Now, before I introduce the speakers, I want to talk about one thing, which I think is important, right? What we call lifestyle medicine has really two aspects. And I discuss this kind of broadly. One is the clinical side, the healthcare side. The other one is the private sector. And I think in the last talk, in the Arab panel, that was great. There was one doctor that works in a clinic, another doctor that works in a more private setting. And so I think that's important. And this panel today is more about the private side of things in terms of lifestyle medicine, lifestyle habit change, wellness, well-being, health, coaching, and so on. What can we do to support actually the clinical side, which we know doctors are totally overwhelmed. And so again, thank you so much for being here, everybody. Type into the chat box with your questions, which we hope you're going to answer in a minute. So let me bring in our panelists, which is, we call it Turkey panel. And we have amazing presenters here, highly qualified. And I want to start with Yeliz Ruskar. Hi, Yeliz, how are you? Yeliz, so good to see you.
Hi, Johannes. I am good. So good to be here. So good to be back. Oh my God, this is the 50th.
Yes, and just for everybody to know, like a few years ago, Yeliz was so powerful in helping us to establish the summit. We worked so hard, right?
Yes, we did it.
Yes, we did, and now it's been growing into like an annual event that is reaching more and more people, and I guess I would say about half of our audience are healthcare providers in different forums, half of it about someone that has chronic health issues that needs help, health lovers as we calling them, right? That want to learn more. And so thank you so much for being here. I just introduce quickly everybody because I'm sure you can talk more about your work. So Yeliz has been in this field, wellness, holistic health, lifestyle medicine for many, many, many years right now in the PhD program in lifestyle medicine at the Lifestyle Medicine University. And there's a lot of other amazing things, like heavily involved with Anthony Robbins and many other venues, and also locally, obviously, Turkey having a private practice. So thanks so much for being here, Yeliz.
Absolutely, Johannes. It's our pleasure. I mean, thank you for providing us this stage, because along with me, I have the giants on this stage, and I cannot wait to start our panel, which is going to bring a lot of new information, and I hope it's going to enlighten many others that are listening to the summit.
Wonderful. And thank you, by the way, also most important, to help organize this panel here in Turkey. So let me see. So let's bring in, I say tall guy. I hope I pronounced that right. How are you?
Hello, everyone.
Yeah, good to see you. So I think in Turkey, most people know you, right? You're famous there as being an actress and kind of a health wellness influencer with a big audience. And thank you so much for being here and kind of hosting, guiding the panel discussion. Really, really appreciate that.
Thank you. I appreciate that, and I really want to support you, Yeliz, and you, because your efforts is priceless. Thank you so much.
Oh, thank you. Really appreciate it. Now, our additional panelists are Professor Ugur Sezirman. And I guess, guys, I pronounce it's correctly.
It's okay. It's all, okay, but that's okay. It's a very difficult name. It's a pleasure to be part of this good event and reach out to so many people all around the world. And thanks for the invitation.
Well, thank you so much. And you are also extremely known, not just in Turkey, but internationally, about your work. And you probably explain it better than I do in a minute, about, the Acıbadem University, you're a professor there. You do a lot of really, really exciting things, right? And maybe you can share about that in a minute, and so everybody knows. And you're very progressive, which I love.
Thank you. Thank you.
Actually, right? Why do things the way they have been done in the last 20 years if we can do it better, right?
That's true. That is true. I'm part of
Exactly.
the medical faculty at Acıbadem University. It's one of the best medical schools in Turkey. But I am a computer scientist. I am an engineer. And I'm doing lots of artificial intelligence work using the omics data, this next-gen sequencing data that gives us a lot of information about what's happening in the human body and help us develop personalized approaches. But we are working with massive amount of data, and to process this data together with omics data, we are also taking into account the lifestyle data, and also we have wearable sensors. Our phone is a sensor as well. We have lots of data coming in from those. So integrating those together with artificial intelligence approaches and developing potential risks and potential solutions, personalized solutions. That's what I'm working on. I have several ongoing projects, EU projects, and lots of projects going on in Turkey as well. And I have a company. I have actually now several companies all around the world providing solutions in these topics.
Oh, wonderful. I'm sure we hear more about that. Thank you so much for being
Thank you.
here. Next, we have Dr. Yushal Badmashi from the Life Club, being Life Club medical director and being very active in also finding solutions for habit improvements, wellness, well-being, and health, more in a private sector. So thank you so much for being here. Hope you can hear me. Let's see.
Hello everyone. I have a connection problem. I think you said my name.
Yes.
Is that true?
Yes, exactly.
Okay.
Yes.
Welcome to everyone, and thank you all participants who make effort about organizing this meeting. Hello everyone again.
No, thank you so much for being here. And we talk a lot more, obviously, what you do and your impact in terms of how we can actually make these changes in terms of general public's health. And so we have also here Ogushan Surau from We Health, which is also a private enterprise, private input or trying to find solutions, and scale that obviously educate about healthy lifestyle. So thank you so much for being here.
Hello, I think it's the hardest name is mine, but you pronounce it perfectly.
Well, stop pronouncing mine.
Johannes.
Oh, thank you. So I think what I'm gonna do is, if that's okay, I hand over the mic to Arce about kind of diving into this panel and guys, I mean, I'm totally okay. It's going to be flexible. I mean, what I'd like to see is obviously understand in Turkey, for example, which probably is similar to worldwide. What is it you feel needs to happen? Maybe healthcare, right? Some of you are in healthcare, some of you more in the private sector. What needs to happen to make, as we calling it, lifestyle medicine and health coaching accessible to everybody? Because I think we all agree chronic disease epidemic is major and we need innovative solutions. So here we go. Have fun.
Yeah. Thank you, Johannes. Yes, it's truly a very important issue because, this pandemic and everything. So it's a truly pleasure to moderating such a panel with experts, have such valuable perspective to share. So this summit is a wonderful opportunity to explore transformative potential of lifestyle medicine, especially with the unique insights brought by our panelists. We are joined by experts who have significantly impacted the fields of wellness and healthcare. So I'm pleased to acknowledge that our Summit Turkey partner, Yeliz Rüzgar, she's the founder of MENA-ARABIC and Power Coaching US. Now, I will start with Yeliz, gentlemen, with your excuses. So, Yeliz, you made a remarkable impact through your work in lifestyle medicine. Could you share with us what a lifestyle medicine and is what the 6+1 pillars that define it are? Because as we kick off this panel, what do you hope we can achieve together today's discussions?
Beautiful. Thank you so much, Aisha. First of all, maybe we can have other microphones go off because I can hear my echo. That would be lovely. And hi, everyone. Very honored to be here. And I want to say good morning, good afternoon, or I shall say good now, wherever you are in the world. And as Aisha mentioned, my name is Yeliz Rüzgar, with a passion for integrating life purpose and wellness. I am currently pursuing a PhD in lifestyle medicine at LP University on health technologies, and I'm truly, truly honored to share this stage with these giants in healthcare system in Turkey. Before again I dive into Aisha's questions, I also want to thank Johannes, the founder of Lifestyle Medicine Foundation and LP University. With him, we go way back. We have a friendship and business partnership of over 20 years. It is such a pleasure to support him with his global cause. Back to Aisha's question, what is lifestyle medicine? In the simplest form, lifestyle medicine is the practice of evidence-based, this part is super important, evidence-based lifestyle interventions to prevent, treat, and reverse chronic diseases like heart disease, cancer, diabetes, arthritis, allergies, and nearly, when we look at the numbers, nearly 60% of American adults have at least one chronic disease. And 50% of our population in Turkey, unfortunately, we're facing at least one chronic condition. And all these chronic illnesses, whether in the US or Turkey, actually, it can be reversed through lifestyle medicine, focusing on the root causes and focusing towards a holistic health approaches. So it is a comprehensive strategy that goes beyond treating symptoms to target the underlying causes of all diseases. Another question that Aisha addressed is the 6+1 pillars. Why do we say that? Because the seventh one is my passion, is the life purpose. But before we even go there, the 6 pillars of lifestyle medicine is 1, nutrition, 2, physical activity, 3, sleep, 4, stress management, 5, substance avoidance, 6, love and connection, our social connections, and the 7th pillar is life purpose. The 7th one is the essential element that aligns mind, body, and spirit towards healing and well-being. Again, before I go even further with the 7th one, I want to hand the microphone to the giants in this field, because we're going to be focusing on epigenetics. We're going to be focusing on personalized healthcare systems in Turkey and in advancing lifestyle conditions to become a standard in healthcare system. This is the goal that we would love to achieve at this panel. And the key is precision. Epigenetics, which Uri is going to be talking about, it's going to tell us that our genes are not our destiny. Our lifestyle choices can influence gene expression and significantly impact our health. Personalized healthcare systems, which Osan is going to be, delving into his wisdom, is going to be the future of healthcare. And with Yujal, we're going to be talking about the AI-driven diagnostics and what Acıbadem is doing in Turkey. With that said, less of me, more of you guys. I'm handing the microphone straight back to Aisha.
Thank you. It was a very powerful, very insightful opening, actually. So we'll dive into the discussion. So we'll address some of the key issues, guys. The impact of integration of lifestyle medicine in Turkey and beyond. Our first theme is about the healthcare system and its challenges. So I will start with Professor Dr. Uğur Sezarman. Dr. Sezarman, when discussing chronic diseases, what are the key implications in epigenetics and the role of the microbiome? Also, how do new generation sequencing technologies, like as you mentioned before, come into play, and why are they crucial into this concept? Furthermore, how do these advances connect the lifestyle medicine? So when personalized, when addressing challenges like elderly care or something. So, Dr. Uğur.
Thank you, Ayşe, for nice questions. And thank you, Yeliz, for introducing the topics very well and the 6+1 pillars. I strongly believe in all those pillars, especially the +1 part. As you said, it should be evidence-based, and we have lots of information coming in from this next-gen sequencing technologies. Next-generation sequencing technology enabled us to obtain the gene sequences. It also enabled us to get the abundances of RNA sequences. It enabled us to measure the microbiome abundances, and it also enabled us to find out other omics technologies like epigenetic changes, which is the changes that occur upon the genetics. So we are not destined with our genetics. Genetics tells us what we are prone to, what's the genetic inheritance is giving us, and what kind of risks are there genetically. But that doesn't mean that we are going to develop those diseases. And epigenetic plays a key role in this aspect, where we can measure it using the sequencing technologies. And it tells us which genes are turned on and turned off. And these things change with your lifestyle. So lifestyle medicine is very crucial in that aspect. So it changes with your diet. It changes with your stress level. It changes with everything, with your life purpose as well. So that's why you can have a strong impact on your genetics. So you're not destined with your genetics only, but your lifestyle has a big impact on your health status as well. So these things are measurable. So through these things, and if you find out some personalized risks and find out personalized solutions, lifestyle changes, like dietary changes, exercising, specific types of exercise that's your body would more likely to respond. So we can find out personalized solutions, you integrating all this information I mentioned together with the other clinical measurements and sensory measurements. We can find out personalized risks and personalized solutions. And these solutions can be very basic solutions, dietary changes, specific exercise programs, specific supplements, and then you can see before and after results. So this is evidence-based. You can see how well your body responds to the solutions provided and how well you feel. And it's also important for preventive medicine, because the preventive medicine is going to lift the burden, economic burden on the healthcare systems and insurances as well, because you're going to keep people healthier through basic changes, lifestyle changes. So I think lifestyle medicine has a great potential in that aspect. And we are working on finding out solutions, taking measurable things into account and developing models, identifying risks, identifying simple solutions, and then tracking how people are adapting to it, how much change do they achieve in their life and in their health status. But for that, for the technology to be adapted, for the solutions to be adapted, it should be wanted by the people. And I had given an example in our earlier discussion with this panel that I was part of an EU project where they were developing robots for elderly people to help them with their daily life routines. And when we visited Finland, there was a ball-shaped robot that came over to this elderly house and reminded the patient to take their medicine. And it was quite innovative back then. And when we finished the project, we went to the same care unit and the ball was not there. And when we asked, where is the ball? They said the robot kept on reminding, take your medicine, take your medicine. And the patient got bored and kicked the ball. So if it's not accepted by the end user, it's pointless to push all these technologies to them. So the key point in this case is you should involve the end user when you're developing a solution and the technology so that it's easily adopted by them, it's accepted by them. And lifestyle medicine is providing easy solutions, easily adaptable, easily applicable, and that's why it has a great potential.
But you know that I know that you've been studying lots of European Council projects, and you mentioned about one example. So when the personalized healthcare system, you mentioned about, but the elderly care, I think is because the preventive care plus our discussion here is lifestyle medicine. You said it much more adaptable, but can you give deeper examples or furthermore examples illuminate us for the resolution of the elderly care, Dr. Ur?
Okay, especially for chronic diseases, they have lots of chronic diseases risks. Unfortunately, with age, we will all have chronic diseases, and like diabetes, like neurological diseases as well. So through these measurements that we are doing, genetic measurements tells us your proneness for certain diseases, and genetic measurements tells us everything actually. What dose of drug you should be using if you're going to take a medication. For some people, a small amount is sufficient because they are fast converter of the drug and the metabolism is very fast. And fast metabolizers, they don't need heavy dose of the drug. And heavy doses will have adverse effect, for example, for those individuals. Or what kind of food they should be using. From microbiome profiling, we can understand whether they are using too much of certain amount of food like dairy products and so on, what kind of food they should lower the consumption of, what kind of supplements they should take personally. Through all these measurements we are doing using this omics technologies, we can get a good snapshot of their health status and what are the risks that they have. And through changes in these risk factors, and these changes include dietary changes, use of certain supplements, avoiding certain type of food, or doing some brain exercises, neurological exercises for the people that have at risk for neurological functions and short-term memory loss and these kind of things. There are lots of games that they can play that can help them from or delaying the problems, and they can help them avoiding certain diseases. And also technological help. There are certain things that they can use through the technologies like robots, as I said, if they're easy to use, or our phone can enable us, empower us to control our life, and they can give us reminders and so on. So these are easily adaptable technologies, but all the solutions should be personalized. Aspirin is not good for everyone. So it's very good for some people, they will respond to it very well. It's not good for other people and they will not even respond to it. So you have to find out through these measurements their health status, what they will respond, what they will not respond, and provide personalized solutions. But 6+1 is that one is very important. We are providing lots of good solutions to people, but adapting it, making it a lifestyle change is very difficult. That's where Yeliz comes and this panel comes into play, because there are other ways. People should want to change, adopt this change, and otherwise it's pointless. It's a temporary change, and they go back to their old habits.
Thank you for engaging discussion. Yeah, thank you. So I will continue with Oğuzhan. Oğuzhan, hello then. Can you share insights of current state of personalized medicine? Because Dr. Uğur mentioned about a little bit, but the statistics and the highlights is growing importance, I guess, right? So what trends do you observe in adoption of personalized healthcare in Turkey, and especially considering the digital transformation of healthcare sector?
Thank you very much. I'd like to show you some slides and numbers if you don't mind.
Sure.
But first of all, I'd like to say that I am professional sick. So that's why I'm in healthcare industry. I have type 1 diabetes, I have celiac, and I had thyroid cancer. So
maybe we can little bit, because the Johannes couldn't introduce you properly. So maybe you can mention about little bit, tell us your story, right?
My past, my career, I was in a cigarette company first, and then a wine company. My life was so nice. Yeah, but because of my illnesses, my doctor told me that I will die soon if I continue on these industries. I had to go to the healthcare sector. It was not my choice, but I had to. It's been 20 years now. So my view, not like yours, I'm a professional consumer of these services and everything. So I'm very happy to be here in a chronic disease management panel like this. And I'd like to show you some of my examples, if you don't mind, just sharing the slide
please.
now.
Sure.
I have to show it. 1 minute. Sorry for bothering. Yes, I found it, I guess. So can you see it now? Can you see it?
Yes, we can see.
Okay. So personalized health means I ask the same question when I start these conversations. Everybody buys a new phone. For example, I think iPhone 16 is now in the market. And when we buy the phone, we personalize everything. We personalize the ringtones, our photographs, everything. When we buy a car, we personalize it, everything. So why don't we personalize our own health? As Dr. Uğur said, personalized medicine is, I think, the very most important part to manage your health. I just checked at World Health Organization. To be well, to live long, they say that 3 things is very important. One is physical health. You can live with the best version of yourself. The second one is mental health, not to lose sight of being mentally healthy. And the social well-being. Your social well-being plays an important role in your overall health. So according to myself, as a chronic ill person, I try to change the look of healthcare sector a little bit, because in my past I worked in hospital groups, I worked in insurance groups, and all the main focus was illness, not wellness before, as all of you know. So first of all, we have to analyze the person. We have to see all the risks at the highest level. What are the risks? After finding the existing problems, we have to see how can we solve these problems, or how can we get in front of these problems, not to make big problems, much more big problems in the future. And we should keep these people well with the data, as Dr. Uğur said. So personal healthcare management should be at home. Home is very important now. For example, as I told you, I'm type 1 diabetic. I went to the doctor, I think, 6 or 7 years ago, because she wants my tests, my blood tests, and etc. And she wants to see my measurements. And then she says, okay, you're okay or not. So the home care is very important in managing these kind of things. And hospital side is also very important, because in the hospitals, we don't, chronic disease people are not sick. They are well, actually, and they want to live longer. So the hospital design should be changed according to these personal needs. And the genetic tests, I will show you some examples now, is very important, I think, in managing healthcare personalized. Of course, mind is getting more important. I don't want to go inside it. And our business life and business solutions. So most of the people get sick in their business lives or offices. So we have to manage on this side also. So how can we do it? First, when you do the genetic tests or genetic checkup, you should see which kind of risks you have. I mean, my risks are different, Ayşe's risks are different, and Dr. Uğur's risks are different. So if we do a regular checkup, it's just looking for standard things. I mean, not personalized. After doing the risk checkup, for example, my risk can be something else. Let's say prostate cancer, and Uğur's risk might be something much different than he can be type 2 diabetes. So if we do the checkup, we don't see things like this. This is the very important thing. And fit means you can do sports according to your PT or some programs online, but is it suitable for your body? That's very important, actually. And eating means what you should eat. We are, for example, if you go to a dietitian these days, they have some diet lists, or they can do something special for you, but they don't know how your body. They don't know how. I'm saying this like they don't have your user manual, so it's just standard. Sometimes it's just standard diets. And age. What is your chronic age and what is your biological age? This is very important, I guess. For example, before doing these kind of programs, my age was 7 years older than me. After getting in a discipline and according making my healthcare management personalized, now my age, biological age, is much more lesser than the chronic age. So how about your immune system? How is it? Do you know it? For example, in COVID times, maybe all you remember, some people who were doing sports and did never smoke, did never drink, died from COVID. And some people who were smoking a packet of cigarettes per day or drinking didn't die. How did this happen? So we should see also this one. So I want to show you a photograph. This is my photograph 3 years ago. I told you I have type 1 diabetes, so I don't eat any sugar. I have celiac. I cannot eat any gluten or pizza or bread. I was living healthy. I think I was living healthy. My doctor was always telling me to have breakfast in the mornings because I'm type 1 diabetes and you should not go to you should not, your sugar level not go down. And my cholesterol level was so high from my childhood, was telling me not to eat any protein or any meat in the evenings. And he was telling me to walk every day minimum 10,000 steps. I was doing this for years and years and years. But after I did my genetic tests and after I learned the results, the tests were telling me not to have any breakfast or not to eat anything 5 hours before I wake up. So you wake up in the morning and 5 hours after you should eat something. And very interesting, because due to my cholesterol levels, my genetic test told me to eat only meat in the evenings. And after 6 o'clock, 7 o'clock, stop eating, but eat meat. And the other interesting thing, don't ever walk. Forget 10,000 steps. Don't ever walk. Even when you start gym to make your body warm, don't walk. Just do sports with 40 kilograms weight. So I showed this result to my doctor. She's a really good professor in Istanbul. And she told me, if you do these things, the result will not be okay. So this is my today, actually. I just did whatever my tests told me to do, and I lost 35 kilograms. I was doing 5 insulins per day. Now I'm doing 2 insulins. So my cholesterol level went down. I stopped using the pills. My friends are asking me, did you have bariatric surgery or are you using Ozempic or something? But I don't. I just did what my body told me to do. So I can give this example every time. Personalized medicine is really our future. So I will share you some numbers and finish it again. I just got a report from the company. We are managing 142 patients which are type 2 diabetes and joined the program last year in August. And by this year, 28% of them health problems were solved at home. They didn't go to hospital. They called us to get an appointment to a hospital, but all the problems were solved at home, 28%. And the other number is 14% decrease in their total insulin usage. If you think 142 people, this is a huge amount. And the other thing is 59% of the oral medication like metformin or other oral pills, they stopped. Not stopped, let me say the correct word. They just lowered down the doses. And 2.1 decrease in their total hemoglobin A1C level, which is really success. So I just want to stop sharing. From my own example and from the patients, we definitely see personalized medicine is the future.
Yeah. Thank you. Thank you. Very powerful insights. I believe it's that too. And also lifestyles, because you have a courage to change your lifestyle. because I think it's the importance of we know this, the medicine makers, like lawmakers, but it's like kind of different kind of epidemic, right? So I will turn to Dr. Yücel. I know him personally, Dr. Yücel, very well. Happy to see you here. So he's a medical director of Life Club. It's a personalized health management platform in Turkey. So Dr. Yücel focuses on integrating preventive healthcare strategies to extend both lifespan and health span. His approach emphasizes the importance of nutrition, which all of the panelists mentioned about it, physical activity, stress management, and immune system support to help individuals prevent chronic diseases and improve their quality of life. So Dr. Yücel will share his insights how lifestyle interventions can be pivotal in achieving a healthier and longer life, right, Dr. Yücel?
Thank you, Ayşe. Great introducing me. I can go on, I think. Today, I want to tell you Life Club Health Management System, which is designed holistic medicine approach with evidence-based medicine. First of all, I want you to remind health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, according to World Health Organization, as Oğuzhan said before me. As you know, all over the world, life expectancy is getting longer day to day. And most of the people wonders how they can have a long qualified life. We ask our members what's changeable factors in your life because the global burden of disease study estimated that in 2019, 51% of worldwide cancer deaths in males and 36% of those in females depends on changeable factors such as behavioral, environmental, occupational, or metabolic risk factors. Smoking was the leading risk factor for all adults, while other important risk factors included alcohol use, high body mass index, and unsafe sex. In our clinics, with a holistic view of your health, under the guidance of your Life Club doctor, who will be specially assigned for you, you can safely manage your health in 3 states. One of them, analysis of current situation, and the other one, identification of improvement areas, and the last one, regular follow-up for sustainable healthy living. I want to explain our health management approach more detail. First of all, your Life Club doctor examines medical history from your electronic medical record or any shared document by you first the meeting. And the second step is holistic face-to-face examination. In this step, the Life Club doctor takes your family history, your own medical history, including social life, exercise, sleep, immunization, diet routine, etc. In this direction, laboratory and radiologic examinations are being carried out. As you know, in Turkey, in private hospital, a meeting takes 20 minutes, a physician meeting. In our first physician meeting takes at least 1 hour. I can say this is a big difference. The next step is analysis with personalized comprehensive examination about your current health status, data analysis by your doctor. Immediately after your Life Club physician identifies your current situation, areas for improvements and risks. By the way, he creates a Life Club health plan for you. And the last step of our health management approach is follow-up. The team follows up the Life Club health plan for sustainable health management together with the member. This collaboration with the member is so critical for health sustainability. We can divide 5 dimensions our health plan. First dimension includes periodic health examinations and tests. Besides, why do you need it? It's personalized, as the other speaker says. Other 3 dimensions are nutrition, exercise, and sleep. And the last dimension is about your immune system. Which vaccine do you need? Tetanus, hepatitis A, hepatitis B, or something like that, etc. And we follow last technologies about preventive care. One of them is full body MR. It provides detection most of tumors and early stage. Detection of intracranial aneurysm is critical. I want to emphasize that because the prevalence of intracranial aneurysm is nearly almost 6%, I can say. In this examination, the person doesn't take any radiation, in MR tests, and no contrast is used in this test. The whole body MR process is completed in approximately 50 minutes in our hospitals. On the other hand, when we look at how do digital health technologies help us to direct our health, digital health technologies support lifestyle changes by allowing individuals to track their health data in real time, as Oğuzhan says his own history before me. Wearable devices, applications, and digital health platforms increase awareness of personal health management and improve doctor-patient communication. At this point, our technical team are working to integrate Huawei Watch to our hospital EMR system. I can say this. And in particular, AI and big data analysts provide personalized recommendations, making lifestyle medicine more accessible. Additionally, they enable individuals to take more responsibility, to have greater agency in managing their health through objective data under the supervision of their doctors. And we aim to make our members become more motivated to control their health and provide them social support in our app specific group, for example, diabetes patient group in the near future. If I can go on, in our clinics, I can say we suggest some recommendations to all of our members. What are these? Let me introduce them. Avoid tobacco use, be physically active, maintain a healthy weight, eat diets rich in fruits, vegetables, and whole grains, and low in saturated trans fats, red meat, and processed meat. Limit alcohol, zero is the best, of course. Protect against sexually transmitted infections. This includes vaccination against human papillomavirus. And protect against the sun and avoid tanning baths. It's so important. As you know, sometimes it becomes a moda.
Yeah.
Get enough sleep time. Get regular screening for breast, cervical, colorectal, and lung cancer, conventional methods beside whole body MR, and cardiovascular risk factors such as hyperlipidemia, glucose, and hypertension, etc. Individually planned risk analysis. Let me explain why we suggest all of this to all the people. As you know, tobacco use is the most important preventable causes of cancer and accounts for 21% of total cancer deaths worldwide. Smoking is the strongest risk factor for lung cancer, increasing risk 10 to 20-fold. But besides this, smoking is also implicated as causative factor for leukemia, as well as cancers of oral cavity, nasal cavity, paranasal sinus, nasopharynx, larynx, esophagus, pancreas, liver, stomach, cervix, kidney, and large bowel.
And so, Dr. Yücel, can I interrupt you a little bit? Because I think our panelists and the watchers that have their information, I want to go a little bit about the digital health technologies, because I know this Acıbadem companies in Life Club, you support the implementation of these lifestyle changes, but during this digital healthcare technologies, which I tried them, which is what I feel like very, very futuristic, because it's like a whole body EMR. And you mentioned about before the, this wearable healthcare technologies such as smartphones, but smart watches like Huawei technologies. Maybe a little bit dive into that. Maybe our panelists and our watchers that now they can have much more further information about it. Digital healthcare technologies and your company's implementation about it.
Of course, as you know, whole body MR couldn't done everywhere of the world. It's only a few hospitals can do it. It's a big power for us, I can say. And I can say it's we can mention our most of members with whole body MR early stage cancer and aneurysm. For example, renal cell cancer. As you know, renal cell cancer, there isn't any tool for renal cell cancer to screen it, but whole body MR is covering
catching it, right? Diagnosed in the early stages.
Yes, of course. And I can say prostate cancer, it's more strong. It is most strong area for whole body MR. I can say from our members.
You have lots of powerful tools, I think, but today's information and the discussion about not the illness, about the health, so lifestyle medicine. So I will continue. Thank you so much, Dr. Yücel. I will continue with our another speaker, because she's also she's a MENA well-being, and she's actually main panelist of this and sponsor our panel, Turkey panel, Yeliz. Yeliz, so in your previous talks, you mentioned about the 6+1 pillar of lifestyle medicine, and with the 7th pillar being of life purpose. I know it very well. So as we continue explore these perspectives, it's the perfect time to dive into how lifestyle medicine ties all of these elements together, right? So in the light of what we discussed before, how does connected it one's life's purpose help it addressing the root causes of health conditions, and why is maintaining human touch so crucial? Because we talk about the technologies. Yes, we called about the gene technologies, the whole body MRs, and all the technologies, smart technologies, futuristic technologies, but the human touch, I think human touch is so crucial, right? Especially in a world that increasingly relying on the technological advancements. What good do you say about it, Yeliz?
Absolutely, Aisha, and our audience. Oh my God, I told you I am on this stage with these giants. What a pleasure to be here again. Amazing shares. And Aisha, yes, we are in that era. We are in that era that we remember we are not human doings. We are human beings. In this era, we get to extend our lifespan. But why? What does it that awakens us in the morning? What does give us joy? So yes, I'm going to be talking about the 6+1 pillar, which is the life purpose. And the idea of purpose is not new. Many ancient traditions, including Sufism, Kabbalah, Buddhism, Chinese traditions, as well as Abrahamic religions, talk about the importance of life purpose, the meaning of life. However, modern science is now validating what these traditions have known for centuries. Research consistently shows that individuals with a strong sense of life purpose live longer, experience fewer less health problems, and they can recover much more effectively from illness. So you may be wondering, and trust me, I was one of those, and I was thinking, how does a life purpose actually impact our biology? I was one of those that was asking this question. And the answer lies in how purpose interacts with our body's physiological processes. Studies have shown that people with a strong life purpose are less likely to develop chronic diseases such as heart diseases, Alzheimer's, even for some cancers. For instance, a meta-analysis found having a strong sense of purpose is associated with a 23% reduction in mortality risk.
Wow.
Yeah. It's not just about living longer, it's about living healthier and happier. And you know what, as you said, wow, let's dive into the numbers. Let's look at more numbers.
Because I think it's evidence-based, right?
It is, absolutely. Another research indicates that individuals who report a strong sense of life purpose are less likely to experience high levels of stress and inflammation. Both of these are the key drivers of chronic diseases. In fact, purpose has found to significantly reduce levels of pro-inflammatory markers like C-reactive protein, which is associated with cardiovascular disease.
Yeah.
And historically, it was Viktor Frankl was one of the first to recognize that purpose is a critical component of optimal functioning, especially when faced with the biggest adversity ever, death.
Yeah, death times.
Yeah, absolutely. And this Viennese psychiatrist and Holocaust survivor, he often cited Nietzsche's quote, and he said, "Those who have a why to live can bear almost anyhow."
Yeah.
And all these studies that Frank did, he saw that when a person has a life purpose, they were more, they were able to adapt positively to conflict, to war, to disaster, to violence, even abuse. And they tend to learn and grow from these extreme experiences, transforming pain into purpose. And it's the same thing with illness. When we can find purpose or a meaning or a mana or find the root cause of that illness, we can even transform the word illness into wellness. And this is called a growth mindset. Another study around growth mindset is from a Stanford psychologist, Dr. Carol Dweck. She researched that having a growth and purpose mindset enables people to thrive during the most challenging times. This could be a disaster-like epidemic, or it could be a war. So again, the question is, what does it mean to have a purpose in life? How does having a sense of meaning affect our overall well-being? Well, another study that I would love to highlight will be Burton Singer and Gayle Love. And this study was established in 2004. And they were looking into these older women with a high sense of purpose. And Ur was mentioning about his EU projects also supporting elderly people. So having a life purpose, these elderly women, they had lower cholesterol and reduced inflammatory responses compared to those that didn't have a life purpose. Another statistics in 2010, Patricia Boyle. Oh my God, that's one of the researches that I love, because it's very much related with my father and also with my uncle. So her and her colleagues at Rush Alzheimer's Disease Center found that individuals with a higher purpose score, PIL, were less likely to be diagnosed with mild cognitive impairment and also Alzheimer's. Yeah, so there are many, many things that life purpose contributes to. This is around Alzheimer's or lowering cholesterol. Oh my God! Of course, Johannes was actually earlier mentioning about Tony Robbins and my involvement as a trainer.
Yes,
there is a study that Stanford conveyed with Tony Robbins and his seminar called Date with Destiny. And in that seminar, participants experienced significant and lasting improvements in emotional well-being and life satisfaction. Because in that seminar, along with me and 300 trainers and Tony Robbins, we get to help people, individuals, clarify their life purpose. And they align with their values, which is leading to measurable reductions in stress and anxiety.
No, I think today's is, I need to interrupt a little bit, because I think there are watchers and now the participants, maybe that the question popped their minds that how can I find my life purpose? Or what is the life purpose? Maybe you can little bit do the exam for us, because the people much more little bit is not the the rescuing like a Superman, the rescuing the human beings or something, like it not becoming a war hero. What is the life purpose, and how can one individual find the life purpose? Is it easy or hard to find?
Oh, that's a beautiful question, Aisha. Thank you for asking that. I wasn't expecting it, but I would love to answer that question because this has been my passion for life. Well, the thing is, it depends. It depends on the person. I mean, we all come to this life with a unique purpose. And you can believe this, or you can believe that there is no purpose in life. Either way, whatever you believe will become your destiny, will become your truth. But in a nutshell, psychologists searched this and philosophers talked about this under the stars, and some said the purpose of life is joy, some said the purpose of life is pleasure, some said there's no purpose. Sufis said it's not about how we show up in life, it's but more about the intention that we have. We are in a big test, and Kabbalists said the life purpose is about becoming one with light. And all of these things, when we look at in science, and especially the work of Dr. Dan Buettner that he conveyed with NIH and also National Geographic, life purpose is about being able to wake up with a happy face and joy and enlightenment and gratitude. How can one find their life purpose? So before I dive into that 5 things that they can look into, I also want to talk a little bit about Dan Buettner and NIH, National Institute Health Organization, and also National Geographic's research. What they did was they followed people aged between 65 to 92 over 11 years. It's a huge study they conducted. They found that those with clear goals, a purpose, lived longer, happier compared to those that don't have a life purpose. And later on, again, Dr. Dan Buettner and National Geographic, they went all around the world and they found these 5 places which they call blue zones. And in these blue zones, people live the longest. Okinawa, Japan, oh my God, 108 years old. In Sardinia, Italy, Nicoya, Costa Rica, Icaria, Greece, Loma Linda, California. And recently they're looking into Urla, Turkey. So we would love to have Urla as the 6th blue zone.
We will in time.
Yeah, absolutely. And when they were searching the biological parts of these humans, how can they live such a long life and they're happy and they're smiling all the time and they're grateful to everything? They found that they have these unusual high levels of DHEA in their blood. And DHEA is the hormone linked to longevity, a lower cancer risk, and better memory. Interestingly, it wasn't only the diet and environment alone that contributed to higher DHEA levels, but they all had a life purpose. They had something that they're waking up to with joy, that they had this anticipation, they had this compelling feature that they did want to wake up to. So overall, life purpose, again, helps us immensely. And the question is, how can one find their life purpose? So I'm going to tie it around these concepts of ikigai and also mana. Ikigai is a term that Japanese people use. And when we take a look at the terms and the details of ikigai, also later on, I've done a research over 10 years, Aisha, in Middle East, like what would be the correspondence to ikigai in Middle East? And that would be mana, the meaning of life. And here, we notice that when people do the things that they love, so if you were to think of circles, the first circle is about find out what you love to do. Because when you are in love, when your heart is that vibrational level, the frequency of love and joy and abundance and gratitude, something happens, something bigger than us starts flowing through us. We get to be more resilient with whatever comes up in life. So the first question is, what do I love to do? How do I feel love in my heart? The second circle is, what are my talents? What am I good at? And what am I interested in life? And when I get to do the things that I love, and when I combine it with my talents, and the third cycle is, how can I contribute to something bigger than I am? It could be to my family, it could be to my country, it could be to the world.
Yeah. Contribution and serving, I guess, right?
Absolutely. And the fourth one is, of course, how can I get paid, or how can I create a sustainable lifestyle while doing the things that I love, utilizing my talents and contributing to the life. So overall, 4 circles. In the middle of it is the life purpose. So I would highly encourage our audience to take some time off from their daily lives and then delve into these questions.
Yeah, very important. Thank you. So inspiring. So inspiring. I think we have a little bit much. I think this panel is going to have to end, but this very, very engaging discussion, so very enlightened. So I want to express my gratitude to our panelists, but I think let's have each 2 minutes maybe the key message about maybe you can finally speak about the future of the lifestyle medicine. If you want to, we can have 2 minutes of each of our panelists. I will start with Oğuzhan. What do you have a key message about the future of lifestyle medicine, Oğuzhan?
I think the most important word, I believe, is, illness begins with I, me, wellness begins with we. So we should not think as I, we are all together, we should live together, and we should be healthy together. So let's forget about illness, just focus on wellness, but everybody is different. Let's not forget this. Everybody has their own user's manual. Everybody has different types of bodies, personalized medicine to be well and live happy and old. And I mean, you can live 100 years, but if you live 30 years, last 30 years in the bed, this is not a long life.
Yeah.
Thank you.
Yeah. Thank you so much. Yeah, so inspiring. So, Dr. Uğur, what is your going to be final words about the future of lifestyle medicine?
Actually, I think the future is being in sync with your body. Your body talks to you through different mechanisms, and your body reflects everything that you're going through in your life. And these things are measurable things, like your microbiome changes, your epigenetic changes. There are lots of changes that are happening, and those are the reflections of your body to what's happening in your life. So measure those things, find out what's happening, whether it's beneficial for you or not, and then make the changes that are beneficial for you and make it a lifestyle and find your life purpose. So I think it will have a great future because people are moving in this direction. They don't want to spend time at hospitals. They want to stay healthy as long as possible. They want to be productive, serving the community, serving the world as long as possible. And I thank Yeliz for valuable insights that she provided and all the other speakers as well. And Johannes was asking us what's the status in Turkey. It's a big topic. There are many people being involved in lifestyle medicine, and people are preferring more and more lifestyle-based solutions and changing their lifestyle like Oğuzhan did, but conducted by evidence, by information. So it's not like general practice, this is bad for you, meat is bad for you, this is good for you. It is personalized solutions, and there is enough things that you can measure and find out what's good for you, what's bad for you. And your body will tell you that this is good for you. And it will make necessary changes when it's good for you. As Oğuzhan lost so much weight by not listening to his clinician friend that's following him. And the cost is a little bit high, and it should be covered by the healthcare system because it's beneficial for them. It's going to reduce the cost of burden on hospitalizing individuals.
Yeah.
Insurance companies are opening up to this idea to support the costs and expenses of these measurements that we are doing and helping people to do the lifestyle change and stay healthy as long as possible. And I think that will be the future.
Also, maybe I can add a little bit, maybe the corporations, like the corporate wellness, because it's very
Yes,
important,
certainly,
right?
certainly.
So the
Companies
companies
do.
also has to support
Yes,
that, the well-being stuff. Thank you,
certainly.
Dr. Uğur.
Okay.
And Yücel, do you have one last key message about the future of the lifestyle medicine? I think Yücel is drop off. He went. Oh, okay. Because I know that he's not, maybe he lost his connection, right? So
Possibly,
I
yeah.
think is our going to final our panel. So I want to express my gratitude to all of our panelists that are sharing their expertise, and to our audience for participating in the important conversation. It's clear that lifestyle medicine holds great promise for addressing chronic diseases and improving overall health outcomes. As we continue to explore these strategies, let's work together to make lifestyle medicine a core part of healthcare in our country. Thank you so much, and enjoy the rest of our summit. Thank you, guys. Thank you so much. Thank you, Johannes.
Oh, thank you so much. I just want to come in at the end and say thank you for everybody showing your experience and really educating about what's possible, right? And I want to also call out to, I know in Turkey there's also like a Turkey Association Lifestyle Medicine. It's certified physicians, which is very important, right? The credentials, to build up the credentials and make sure that healthcare professionals especially are trained in lifestyle medicine properly, also engage like probably the government, and to make sure it flows into healthcare in a big way. And I think this synergy where we work together, I think some of you mentioned that, right? It's not just healthcare, but it is all of us. It's corporate, right? It's individual, it's education. There's so many aspects that are needed. And if you've been at the summit, you heard that every country is slightly different, but I think there's this idea of lifestyle medicine or wellness or well-being or lifestyle-based medicine, right, is just really important. We work together as a community and make sure that the public, in terms of public health, we do everything we can to reduce these chronic burdens, because to me, they're like, it's incredible how many people suffer. And I think that's not needed because we know the solution. So thanks again, everybody. Really appreciate it.
Thank you so much.
Thank you. Bye-bye. Thanks.
Thank you so much. Great work, everybody. Thank you. Thank you. Now we're going to be back in about 15 minutes. We have a bit longer break right now. Check in the chat. We let you know when we're back with the South America Spanish speaking. It's actually in Spanish. I just introduced at the beginning. My Spanish is not good, but we're going to have actually, I think most of the pens we have available in terms of local language, right? We transcribe them. So there's a caption, let's say in Arabic or in Spanish or English then. Right, so you can, when you have the replays, you can have that in the local language and you can share it. And we probably upload a lot of the panels into our podcast, so you can also share it and inspire everybody to get involved and learn about healthy living, lifestyle medicine specifically, and health coaching. So we're going to be back about 15 minutes. Stay here. It's going to be a great Spanish, Argentina, Chile, and other country representatives, experts in lifestyle medicine. And we have actually a former government secretary and official talking about the government side, what needs to be done. See you back in about 15 minutes. Welcome, welcome, hello, welcome to our Lifestyle Medicine Summit and our South American Spanish speaking panel about lifestyle medicine, about the importance of lifestyle medicine to prevent, reduce, and reverse chronic health issues, the urgency, why this is so important. And we have an amazing list of presenters and panelists that are going to join us in a minute. Now, the talk is going to be, or the panel is going to be in Spanish, so I'm not sure what I'm going to do because my Spanish is non-existent. But we have a great host here, and I want to introduce to you Christian de la Piana, MD, from Argentina. How are you, Christian?
Very well, fine. Thank you, Johannes. Nice to meet you.
Yes, thank you so much for being here and for hosting, guiding the conversation. Now, a quick introduction. You are president of the Argentina Lifestyle Medicine Association, very active, trying to bring lifestyle medicine into Argentina and other countries, Spanish-speaking countries especially. And in our conversation, we said, well, Argentina is in a very interesting place right now, right? A lot of changes, a lot of improvements, a lot of shifts. And the hope is that Argentina as a country can implement lifestyle medicine as the chronic disease solution because we know it works and it is the most cost-effective way to help to create a public health shift and change. And that's what the panel is all about. So thank you so much for being here, really.
Well, thank you, Johannes. And bueno, I will talk in Spanish right now. Bueno, muchas gracias.
So I guess I'm going to step away. You're going to host and introduce the speakers and go through the introductory talks of all the speakers and then, discussion. And we have about 60 to 75 minutes for the panel, if that's okay.
Okay. Well, I talk in Spanish right now. It's okay?
Yes, absolutely.
Bueno, muchas gracias nuevamente por tu presentación, Johannes, e invitación a este prestigioso congreso virtual en medicina estilo de vida. Y también quiero aprovechar para darles la bienvenida al prestigioso panel que nos acompaña en el día de hoy. Y estaba en estos días repasando algunas cifras que siempre me impactan fuertemente. Y, por ejemplo, tomé dos emblemáticas entidades como la demencia, por un lado, y la diabetes por el otro. Y veía que, por ejemplo, hoy en el mundo tenemos 50 millones de personas con demencia, pero se estima que para el año 2050, que no falta tanto, que ese número se va a triplicar en el mundo entero. Y en cuanto a la diabetes, en adultos, hay hoy en día unos 500 millones de personas adultos con diabetes y se proyecta que sean 800 millones de personas con diabetes para dentro de 20, 25 años. Entonces, yo creo que por eso y para eso estamos hoy y esta semana y en este congreso y como tema central el de la epidemia de enfermedades crónicas, porque creo que nos tenemos que plantear cada vez más qué es lo que podemos hacer para que ese número, que hoy en día es irrefutable, nadie lo puede discutir, pero el número que se proyecta es un número que puede no ser real. Entonces, ¿qué es lo que podemos hacer para mitigar ese número tan tremendo que se proyecta para más adelante, tanto en nuestro trabajo individual como personas, en nuestro entorno más cercano y en nuestro trabajo como profesionales de la salud? Así que, John, ahora un poco para ver qué es lo que podemos hacer con esto, yo voy a introducir uno por uno a los panelistas, a los oradores, y la pregunta que les quiero hacer es un poco qué es lo que están haciendo, por qué estamos acá, qué es lo que piensan que con la medicina de estilo de vida podemos ayudar de vuelta a mitigar este problema. Así que voy a empezar con la doctora Catalina Figueroa y quiero agregar que vale la pena escuchar la trayectoria de los 4 panelistas porque es realmente muy interesante y es admirable la trayectoria que tienen como profesionales hasta el día de hoy. Así que voy a introducir a la doctora Catalina Figueroa, que es médica internista de la Pontificia Universidad Católica de Chile, es especialista certificada en medicina de estilo de vida, es cofundadora y primera presidente de la Sociedad Chilena de Medicina de Estilo de Vida, tiene maestría en Ciencias de la Salud. Actualmente está trabajando en los Países Bajos, en la ciudad de Utrecht, donde está haciendo un doctorado para implementar un programa de medicina de estilo de vida en un hospital de ahí de la ciudad de Utrecht, entiendo. Así que, bueno, Catalina, un placer enorme presentarte y escucharte a ver cómo están tus casos hoy en día.
Bueno, muchas gracias, Cristian. Un honor estar aquí presente con estos tremendos panelistas que ya vendrá la introducción a cada uno. También muchas gracias a Johannes por la invitación y por generar este espacio en que podemos compartir un poco de lo que ha sido la trayectoria de la medicina al estilo de vida en Latinoamérica. Y bueno, si yo pudiera resumir un poco sobre mi trayectoria y por qué yo creo tanto en el rol de la medicina del estilo de vida y la necesidad que tenemos de poder trabajar juntos para avanzar su desarrollo, es que, bueno, yo comencé probablemente como muchos lo han hecho, a veces desde la frustración al ver que queríamos hacer más con nuestros pacientes o en los entornos donde trabajáramos, querer implementar más cambios, tener más tiempo para conversar con nuestros pacientes, también abordar todos esos determinantes sociales que son muy comunes de ver, especialmente en Latinoamérica. Y por ahí muchos fuimos encontrando esta disciplina, formándonos. Creo que todos acá hemos estado implicados en avanzar esto en nuestros países, ya sea fundando las sociedades, liderando distintos proyectos y de manera de poder como esparcir el mensaje y que más colegas, médicos, otro tipo de profesionales de la salud se quieran sumar al movimiento. Así que para mí yo creo que eso es un sello que tenemos todos acá. Y de mi parte, bueno, como Cristian comentaba, yo ahora estoy dedicada a la investigación, pero para mí creo que ha sido súper importante el darme cuenta que para mí es necesario que también podamos traducir esta evidencia que tenemos, que es súper clara, súper fuerte, desde estudios epidemiológicos, estudios clínicos, de que los cambios del estilo de vida son súper importantes como herramientas preventivas y herramientas terapéuticas, pero creo que la implementación de cómo llevar esto a la práctica y cómo vencer las barreras que existen a nivel local, a nivel de las políticas, también el tema de los determinantes sociales de la salud, etcétera, pero cómo podemos implementar programas y entendiendo lo que son nuestras realidades. Para mí ese ha sido un sello que es como de lo que más he querido ir desarrollando en el último tiempo. Eso es a lo que estoy dedicada. Y obviamente en este minuto estoy fuera de Sudamérica, pero siempre con la esperanza de que al final lo que uno puede también trabajar en países donde hay más recursos para generar el ejemplo, después pueda ir marcando la pauta para que también pueda traer eso de vuelta, al menos a mis raíces. Así que ese podría ser mi resumen y estoy muy contenta de que podamos seguir la discusión en este panel. Te devuelvo la palabra, Cristian.
Gracias, Catalina. Muchas gracias. Bueno, y ahora voy a presentar a la doctora Sley Guimaraes. Sley fue la primera presidenta del Colegio Brasileño de Medicina Estilo de Vida, cofundadora, por supuesto, de la sociedad, y dirige un programa de un curso en Harvard Medical School y un posgrado en el prestigioso Albert Einstein en San Pablo y en la Escuela Adapta también. Así que, Sley, te cedo la palabra y un gusto verte y escucharte.
¿Me escuchas? Sí. Hola, muy feliz de estar aquí con ustedes. Empezamos todo en Brasil en 2017, cuando hicimos la prueba de International Board of Lifestyle Medicine y juntamos los médicos que tenían interés, porque se hablaba de muchas cosas que no son medicinas de estilo de vida en Brasil, como hormonas o suplementación excesiva y otras cosas, llamando de medicina de estilo de vida. Entonces decimos, no, tenemos que hacer algo que sea exclusivamente sobre la medicina de estilo de vida. Y sabemos que para que eso se ponga real en Brasil, tenemos que tener muchos profesionales que sepan bien lo que es medicina de estilo de vida. Entonces, empezamos este curso de posgrado que no es solo para médicos, es para todos los profesionales de salud. Y he crecido muchísimo y tenemos la conferencia ahora en noviembre 7, 8 y 9 y estamos muy contentas. No he sido la primera presidenta, el primero ha sido el doctor Renato Baena y estamos muy, muy contentas porque en Brasil tenemos más datos para que podamos hablar, discutir y poner la importancia que es hacer medicina de estilo de vida. Entonces, muchas gracias. Muy feliz por estar acá. Gracias por invitarme.
Gracias, Ley. Bueno, ahora voy a presentar al doctor Hernán Cohen, que le agradezco muchísimo su generosa participación en el panel del día de hoy. El doctor Cohen es cardiólogo universitario de la UBA, tiene maestría en efectividad clínica y sanitaria también de la UBA, maestría en inteligencia artificial de la Universidad Católica de Murcia, tiene un posgrado en salud digital de la Universidad de Cataluña y ha tenido muchas actividades, mucha experiencia en gestión. Ha sido director de un hospital público en Argentina, el Hospital de Arcade, en la provincia de Buenos Aires, también como jefe de cardiología de FLENI, y recientemente trabajó en el Ministerio de Salud de la Nación Argentina como subsecretario de Planificación y Programación Sanitaria. Y fue director de un interesante proyecto del que se llamó 25 por 25 de la Federación Mundial Cardiológica. Así que fue director durante 2 años. Así que, doctor Cohen, muchas gracias nuevamente por tu participación y te escuchamos.
Gracias, Cristian, un placer y les agradezco mucho la invitación. Me honra participar de un congreso así y con panelistas de tanta jerarquía. Sí, como vos decís, tuve la oportunidad de estar en distintas áreas y de participar en la medicina de distintos lugares. Cuando uno se forma en la medicina y en la cardiología, entiende a la prevención como un área fundamental. Siempre hablamos de la costo-efectividad de la prevención, pero siempre hablamos de la prevención también desde el lado más farmacológico. Y a lo largo del tiempo uno va aprendiendo que lo que le pasa a los pacientes muchas veces no tiene que ver con la enfermedad, sino con la salud. Es decir, que nosotros, si pudiéramos fomentar que la gente tenga un cambio significativo del estilo de vida desde todo punto de vista, no solamente desde la actividad física, que es lo que más pregonamos los cardiólogos, o desde la alimentación, sino también desde el bienestar familiar, desde el bienestar social, buscar de qué forma se pueden fortalecer ciertos vínculos, eso sin duda tiene un impacto sobre la salud. A medida que fui transcurriendo por los distintos lugares que me tocó, como decías vos, estar desde un consultorio hasta un ministerio, uno va viendo dónde están los puntos más difíciles, las barreras más difíciles de vencer. Y en estas cosas muchas veces tiene que ver con la educación y con el impacto que tiene lo económico por sobre la realidad de lo que uno quiere transmitir. Con esto quiero decir que hay intereses cruzados muchas veces, por los cuales se hace difícil impactar sobre algo que a la gente le hace sentido, pero que muchas veces no tiene detrás todo el marketing que debería tener. y eso hace que muchas veces la medicina que ustedes con tanto esfuerzo llevan adelante tenga menos penetración en la población que la medicina farmacológica que tiene detrás laboratorios y drogas y fármacos que penetran fuertemente por propaganda, por distintos convenios con médicos, etc. Con lo cual, desde el Ministerio de Salud, en un principio, desde que nosotros llegamos al Ministerio de Salud, el tiempo que nosotros estuvimos, pensábamos que lo más importante justamente es ordenar las cosas. Le habíamos impuesto de alguna manera un formato de rectoría al ministerio para tratar justamente de ordenar y de hacer entender cuáles son los andariveles por los cuales uno tiene que transcurrir, porque a todos, desde el sistema de salud más chiquitito, desde un hospital hasta el sistema de salud más importante, a todos les gusta más participar de la compra de equipamiento o del último tratamiento, porque eso vende más, como decía antes, porque eso tiene más impacto, porque eso se ve mucho más, pero muchas veces ese desorden de que ocurre porque tanto un hospital tiene un determinado tratamiento de alta complejidad y el hospital que está a una cuadra de distancia tiene el mismo tratamiento de alta complejidad, pero ninguno de los dos hospitales se ocupa de estos temas como los que ustedes se están ocupando. Y eso es muy significativo, es muy llamativo, porque los gastos en salud van creciendo de una manera descomunal, el sistema está quebrado por todos lados, no logra hacer pie, y mientras tanto nos seguimos ocupando de la enfermedad y no de todo lo que pudiera tener que ver con el bienestar de la población, con el bienestar de los pacientes, con la prevención desde el estado de salud previo a la enfermedad. Entonces, me parece sumamente interesante el abordaje que ustedes hacen y me parece que desde la salud pública muchas veces se le ha perdido un poco el ritmo a esto, no se ha dado la fuerza, a la visibilidad a todo este tipo de medicinas que hacen que hoy nos dediquemos más que nada, como decía, a tratar enfermos graves y con eso creer que estamos haciendo buena medicina, cuando en realidad la medicina debería evitar llegar a esos enfermos graves gracias a las estrategias que ustedes comentan habitualmente. Así que te agradezco mucho y quedo a disposición para cualquier pregunta.
Gracias, doctor Cohen. Y bueno, por último, quiero presentar a la doctora Sandra Lanza. Sandra es médica de familia, es certificada en medicina de estilo de vida, en medicina de estilo de vida intensiva. Sí, actualmente también trabaja, es parte del comité ejecutivo de la World Lifestyle Medical Organization para el desarrollo en la región de la especialidad. Y maestrías en salud pública, en administración en salud. Es la actual presidenta de la Sociedad Chilena de Medicina de Estilo de Vida. También tiene un cargo en las Naciones Unidas en el área de impacto global. Y recientemente participó en una declaración sumamente importante para este tema que nos convoca hoy, que fue la declaración de Doha, donde referentes mundiales en medicina de estilo de vida se unieron, se reunieron y se generó un documento que celebro muchísimo, porque cuanto más hablemos de este tema, más conciencia tomaremos y más tomaremos cartas en el asunto. Así que, Sandra, te escuchamos.
Muchas gracias, Cristian, por la presentación. No sé si puedo proyectar una presentación, es muy cortita, es para contarles lo que estamos haciendo como Septiembre. ¿Se ve bien? ¿Sí? ¿Pueden ver? Ok. Ya.
Sí, sí, perfecto. Sí, sí.
Ya, perfecto. Bueno, nuestra sociedad en Chile, quiero hablarles de esto principalmente, ya Cristian les habló un poco de mi trayectoria, entonces me interesa mucho contarles qué es lo que estamos haciendo, cómo estamos avanzando en Chile. Y las estrategias tienen que ver principalmente, en primer lugar, con la universalización de las competencias de medicina de estilo de vida. Bueno, como sociedad nos constituimos el año 2020, actualmente tenemos aproximadamente 130 socios médicos, kinesiólogos, enfermeros, y etcétera, otros profesionales de salud, principalmente si somos médicos. Somos miembros de la Alianza Global y de la Organización Mundial. Catalina, como Past President, nos representa en el comité ejecutivo. Yo también pertenezco a otro comité. ¿Qué iniciativa hemos hecho como de difusión y docencia? El año pasado hicimos una capacitación para aproximadamente 600 médicos con el Colegio Médico de Chile, una capacitación de 8 semanas. Participamos también en otras iniciativas con el Colegio Médico que tenían que ver con cápsulas educativas para los médicos afiliados a este proceso, cursos para la Sociedad Médica de Santiago, participamos también en cápsulas de un programa de televisión para hacer difusión, y en jornadas también de otras sociedades, y activamente y frecuentemente estamos participando también en distintos congresos de sociedades científicas en Chile. El año pasado creamos y lanzamos este año en abril un diplomado de medicina de estilo de vida que fue hecho en conjunto con una universidad en Chile y la SOCIMEP y nuestra sociedad. La ventaja de este diplomado es que está aprobado como prerequisito por el Colegio Americano para la certificación. Estamos muy contentos porque pensamos partir con 30 alumnos y tenemos 160 inscritos. Ya está esta semana finalizando la primera corte y hay varios inscritos ya para la certificación, que es en un par de semanas, y estamos a poco ya de abrir las inscripciones para el segundo grupo. Pero también tenemos nuevos programas para el 2025. Hay un nuevo programa de medicina de estilo de vida en paciente oncológico y un diplomado de medicina de estilo de vida en longevidad saludable, que son temas más acotados para personas que tal vez no les interese certificarse, que quieran profundizar tal vez en los temas en que se desarrollan, son de su interés o en los que trabajan. Y también viene un diplomado de medicina de estilo de vida en salud mental. Esos tres son en la universidad en la que trabajo. Estamos pensando también ya en lanzar un magíster para el año 2026. Y esto se suma a la oferta ya disponible, aparte del diplomado que les comenté recién. Había uno previo que fue el primero, el de la Universidad de los Andes, y también en Chile tenemos creo que es el único, diplomado de medicina de estilo de vida en niños. Otras iniciativas en docencia en pregrado en varias universidades de Chile son iniciativas aisladas. Nos gustaría que esto estuviese mucho más formalizado y que fuera parte de las mallas curriculares, pero eso es un trabajo difícil que va a tomar tiempo, pero que estamos trabajando para ello. Y también estamos haciendo cursos para los residentes de medicina familiar, porque nos parece que el terreno más fértil y donde debiese estar sumamente integrado por la continuidad de la atención es la atención primaria. Por eso nos interesa mucho que los médicos de familia puedan ir adquiriendo estas competencias, y esto lo estamos haciendo en 3 universidades. La SOCIMEP hace otras actividades de difusión como patrocinios, auspicios, información mensual para los socios. Los comités hacen distintos tipos de actividades, una semana de medicina estilo de vida que es bastante activa. Y para contarles un poquito de la certificación, que tiene mucho que ver con el Congreso. A todo esto, nuestro Congreso chileno es muy pronto, es del 6 al 8 de noviembre. Y contarles que desde el año pasado ya incorporamos la presentación de trabajos científicos y también una tarde completa que es con modalidad de talleres. Respecto a la certificación, hemos ido aumentando el interés y tal vez puede ser que en unos años más podamos tener nosotros tal vez nuestra propia certificación, que este diplomado que estemos haciendo sea la vía para certificar a nuestros profesionales. Hasta entre el año 2018 y 2023 teníamos 57 médicos, algunas enfermeras, kinesiólogos, en total 63 personas certificadas. Y para este año tenemos 37 inscritos, que es un número que casi triplicó al número de los años anteriores. Estamos muy contentos por ello. La mayoría siguen siendo médicos y tenemos 6 profesionales. Y también nos alegra mucho que tenemos un muy buen nivel de aprobación de un 89% en las certificaciones. Nos interesa mucho también en avanzar en desarrollo científico. Sabemos que ya la medicina de estilo de vida va acumulando varias décadas de evidencia científica, pero nos interesa mucho avanzar en tener nuestros propios datos, nuestra propia evidencia con información local. Desde este año nuestra sociedad tiene 2 directoras científicas y ya tenemos varios proyectos en mente para ir trabajando en lo que queda de este año y principalmente durante el 2025. Respecto a las relaciones internacionales, como le conté, formamos parte de estas 2 organizaciones en la Alianza Global. Forma parte también del comité que está en la actualización de las competencias centrales de medicina de estilo de vida, que van a estar listas ahora en un par de meses. Y el año pasado también fuimos parte del primer foro internacional de líderes de medicina de estilo de vida en Doha, donde salió uno de los productos fue esta declaración de Doha específicamente, y este año, el 2025, que ya para mí como que ya casi acabó este año, viene el segundo foro internacional. Desafíos tenemos muchos. Bueno, seguir con esto de la universalización de las competencias de medicina de estilo de vida, fomentar la educación continua en atención primaria de salud, por lo que les decía, creemos que este es el terreno más fértil para que esto pueda permear más fácilmente, impulsar la investigación y fortalecer alianzas estratégicas, poder colaborar con la implementación de políticas que apoyen la inclusión de la MEP como parte integral del cuidado de salud en atención primaria. Ahí tenemos pendientes reuniones con el ministerio. En esto no nos ha ido tan bien, pese a que trabajamos en varias mesas de trabajo con ellos. Tenemos pendiente algunas reuniones por ley de lobby que no han sido convocadas aún. Queremos utilizar la medicina de estilo de vida, ojalá para poder direccionar las inequidades de salud, y por eso estamos también haciendo varias estrategias de abogacía en ese sentido. Lo de las investigaciones ya está repetido, se los dije, y lo de las alianzas estratégicas también. Y bueno, y como les contaba, está nuestro próximo congreso, que es en un par de semanas, así que si están interesados, ahí está el código, todavía pueden inscribirse. Espero no haberme alargado mucho.
Ahora sí, estaba muteado. Bueno, muchísimas gracias, Sandra. Espectacular el trabajo que están haciendo en Chile, que estás haciendo, liderando en tu país y en el mundo también. Así que, bueno, la verdad que uno es optimista viendo que todo esto, uno que arrancó hace unos años, como todos, vemos cómo día a día podría decirse, ¿no? Que la medicina estilo de vida va cobrando más fuerza, y uno cree que también en la sociedad no médica, no profesional de la salud, también el concepto empieza a tomar cada vez más relevancia. Así que celebro lo que está pasando hoy en día. Y bueno, podemos ahora ver qué es lo que podemos hacer, un poco la idea, ¿no? de este panel y de esta charla y de este congreso es un poco ver qué acciones podemos tomar. Ya hemos visto la actividad que ya se está haciendo, pero bueno, yo quería, después con Johannes, vos me decís si la audiencia quiere preguntar, hacer preguntas y demás, pero yo quería aprovechar siempre en mi actividad me pregunto, ¿no? Y viendo estos números que las personas con enfermedades crónicas aumentan en forma exponencial, podríamos decir, y el número de profesionales de la salud es un poco estático, ¿no? Siempre se egresan un poco los mismos profesionales de la salud, e incluso, al menos en mi país, buscando quizás no las especialidades de atención primaria de la primera, el primer paso, digamos, sino buscando otras especialidades, con lo cual, por ese lado, hay que trabajar muchísimo. Y le quería preguntar al doctor Cohen, que viendo también un poco su trayectoria y sus posgrados en salud digital y en inteligencia artificial, si esa esa brecha que hay y que va a existir cada vez más, y que nosotros lo vemos un poco en la dificultad de las personas en conseguir turno con las especialidades, con los profesionales, ni hablar para los adultos mayores. Si la tecnología podrá ser el camino o uno de los caminos para cambiar los modelos de atención y que haya sea a partir de ahí que este tremendo impacto de las enfermedades crónicas en el futuro, hoy, pero en el futuro aún más, puede reducirse un poco más. No sé qué experiencia.
Sí, gracias, Cristian. Te respondo de manera ambigua, sí y no. Creo que sí puede ayudar mucho. Vos sabés muy bien que hoy hay casas inteligentes que permiten que personas de mayor edad puedan vivir en sus casas con pequeños robots que los ayudan a no olvidar la medicación, a no olvidarse prendida una hornalla, a tener ciertas condiciones de seguridad dentro de su casa. Es decir, la tecnología hoy ha permitido mejorar la calidad de vida de muchas personas que en algún momento terminaban, por ejemplo, hablo del caso de los ancianos, terminaban viviendo fuera de su casa en algún lugar, en algún hospicio donde tenían que pasar sus últimos años porque nadie podía hacerse cargo, nadie podía cuidarlos. Y hoy la tecnología, a través de cámaras, a través de pequeños robots, a través de la telemedicina, ha permitido justamente que esa gente permanezca en su casa con un cambio fundamental en esto que vos hablabas, por ejemplo, de perderse desde el punto de vista de lo intelectual. No es lo mismo para un anciano vivir dentro de su casa que sea llevado a vivir a una habitación en otro lugar. Es decir, la tecnología hoy ya cambió muchas de estas situaciones de mejoría de la calidad de vida de las personas. Eso en un punto extremo, si querés, de la edad. Pero también dije que no, porque también corremos el riesgo de que la medicina la despersonalicemos, digamos, y que esto que se requiere de una mano en la espalda del paciente o una comprensión con un gesto durante una consulta, tenemos que tratar de evitar que se pierda. Es decir, no puede ser hoy, como se escucha en muchos lugares y escucho a muchos colegas, hablar a favor o en contra de la tecnología. La tecnología es una parte integral que tenemos que aprender a utilizar los médicos, los profesionales de la salud y los profesionales de otras especialidades también o de otras áreas también, porque viene a ayudarnos justamente para liberarnos de trabajo, que es un trabajo administrativo. Hoy, cuando llegaron las computadoras, a muchos de ustedes les debe haber pasado que el médico los está atendiendo, pero está escribiendo en la máquina y está mirando la máquina y ya no está mirando al paciente. Bueno, el día que todo eso se pueda cambiar y entonces lo que hagan las máquinas sea todo ese trabajo administrativo que libera al médico para volver a tener una medicina más humana y que a su vez permita que un montón de situaciones que hoy son heterogéneas vuelvan a darnos equidad y que todo el mundo tenga el mismo nivel de atención. Hoy la posibilidad de hacer diagnóstico por imágenes a través de inteligencia artificial unifica un criterio diagnóstico como si estuviera haciendo el diagnóstico el experto más experto del mundo en cualquier país y en cualquier lugar del mundo. Si nosotros aprendemos a incorporar la inteligencia artificial, la tecnología y le damos la utilidad que realmente tiene, creo que va a mejorar la calidad y el estilo de vida de muchas de las personas. Si la utilizamos únicamente para quitarnos trabajo o nos ponemos a pelear con la inteligencia artificial porque no quiero que la máquina me domine y yo soy el médico y cómo la máquina me va a dominar, estamos perdiendo tiempo, no vamos a poder ser mejor que las máquinas. Eso está clarísimo, pero sí tenemos que ser los que manejemos a las máquinas. Y en ese sentido también le tenemos que enseñar a nuestros pacientes y a la gente que las máquinas le pueden brindar información y los pueden ayudar a hacer un montón de cosas, pero que tampoco dejan de lado al médico o a la asistencia que se requiere. Si hoy el doctor Google, que empezó hace ya muchos años, la gente deja de asistir al médico o deja de hacer cosas o toma conductas sin conocer una serie de cuestiones de su salud solamente porque las leyó en algún lugar, bueno, eso también puede ser peligroso. Entonces, nuestra función, y ya termino, resumo, nuestra función es enseñar a los chicos, sobre todo a la gente joven, pero también a los adultos y a las personas mayores, enseñarles a cómo utilizar adecuadamente toda la tecnología que ya llegó. No pelearnos, no ponernos en contra, sino ver qué beneficios nos va a traer a futuro y sobre todo en esto que ustedes tienen tanta atención, en lo que significa la mejoría en la calidad de vida de los pacientes.
Gracias, doctor Cohen. Coincido plenamente con lo que comentabas. Por supuesto que hay un gran terreno por delante y también una necesidad de formarnos también en entender cómo aplicar la salud, la tecnología y la salud digital seguramente en los próximos años esto irá avanzando rápidamente.
Cristian.
Ahora, por supuesto, cada uno que quiera, sí, esto es una charla abierta, digamos, no hay una...
Yo quisiera
Levantan la mano y listo.
agregar algo que me quedé reflexionando. Bueno, estoy plenamente de acuerdo con lo mencionado por el doctor Cohen. Al final, los avances tecnológicos van a pasar, querámoslo o no, y tenemos que aprender a usarlos a nuestro favor. Y eso va en cuanto a las herramientas digitales, pero también ante otras cosas y sobre todo en el campo de la medicina, el estilo de vida. Creo que también hay avances en el conocimiento científico que nos van a impactar en lo que promovemos. No sé si han escuchado el desarrollo de estos imitadores del ejercicio, del efecto del ejercicio físico, y eso probablemente uno puede pensar en pacientes con adultos mayores, seniles, con sarcopenia. Uno puede pensar que pueden haber muchos beneficios, pero también tenemos que empezar a ver cuáles van a ser los efectos sociales en que una población que no se quiere ejercitar, probablemente estos imitadores del ejercicio no confieren todos los beneficios que nosotros vemos en salud mental, etcétera, pero tenemos que adaptarnos y saber bien cuáles son las indicaciones, cuáles son los beneficios. Por ahí también leía que estaban estudiando en ratones otras drogas que serían para hacer que la gente tenga más motivación al ejercicio, y así van a haber múltiples desarrollos, y creo que no los vamos a evitar, no tenemos que ponernos en contra, porque muchas de estas cosas pueden justamente motivar más a la gente hacia como empoderarnos en el estilo de vida, hacer tal vez que este campo sea más atractivo también para gente que quiera financiar ciertos avances, pero eso, y que también esos avances no se queden solamente en el, ¿cómo se llama?, el Global North, que le dicen, los países más desarrollados, sino que también lleguen a nuestros países, y por eso que también el desarrollo de investigación científica local, como lo que mencionaba Sandra en el ejemplo de lo que está impulsando Xochimilco, es súper relevante.
Gracias, Catalina. Muchas gracias por tu aporte. Y ahora, por ahí les quería preguntar a Sley, a Sandra, a Catalina, que están más en el área de medicina y estilo de vida propiamente dicho. Yo reflexionaba, escuchaba hace poquito que estuvo en Argentina, para mí un médico que cuando lo escucho, la verdad que me emociona un montón, que es el doctor Cohen lo debe conocer muy bien, que es el doctor Valentín Fuster, y que realmente ha hecho un cambio en su en su carrera como investigador que es, como estudioso de que es, y que él dice perfectamente que de tanto estudiar la enfermedad ya la estudió, ya la manejó durante muchos años y ahora se dio cuenta que había que ir por el otro lado, que era darle más, ponerlo más arriba en las prioridades a la creación de salud, ¿no? Y él habla mucho sobre los primeros años, o sea, desde la misma gestación. Y yo reflexionando un poco qué es lo que opinan ustedes acerca de la participación de profesionales más pediatras, por decirlo de alguna manera, o obstetras, porque yo creo que ahí está si vamos a hablar de cómo mitigar este tema, ¿no? Por supuesto que se hacen cosas y ahí, Sandra, que también tenés algo para pediatría, pero yo creo que ahí está el centro del tema, es en la educación de los niños, de la embarazada, en promover estos cambios en el estilo de vida desde el vamos, ¿no? De la educación, tanto como pacientes, entre comillas, que como en los colegios, de que las nuevas generaciones entiendan lo que viene y cómo formarse en cómo optimizar su propia salud, ¿no? Cosa que antes estaba muy pasada por alto, pero bueno, un poco eso, ver cómo ven la participación de los pediatras en esta especialidad, ¿no?
Sí, yo creo que la participación, Cristian, de todos los profesionales de salud es sumamente relevante, todos, profesionales médicos y no médicos. Y bueno, sabemos también que mientras antes podamos comenzar con la implementación de hábitos saludables, es mejor. Mientras sea en etapas más precoces de la vida, del curso de vida, es mejor. Entonces, el rol de los pediatras, como comentabas tú, y también de los obstetras es sumamente importante. Y esto se mezcla con los conceptos de la programación fetal, epigenética y todo esto. Así que es sumamente relevante que todos podamos estar en sintonía, y por eso uno de nuestros intereses es poder hacer que estos conocimientos sean universales. Y sabemos que eso va a tardar. Todavía pasa acá que estamos hablando con un grupo de colegas y son muchos. Yo siempre les pregunto, levanten la mano quienes saben o quienes no saben qué es la medicina de estilo de vida, y todavía son muchos quienes no saben de qué se trata, quienes tal vez recién lo están escuchando o no tienen un mayor conocimiento. Entonces creo que mientras ocurre eso, debemos también ir tratando de salir del box de atención, de la consulta 1 a 1, porque si no, como medida de salud pública, no lo vamos a lograr, nos vamos a demorar muchísimos años y sabemos cómo se vienen en aumento todas las enfermedades crónicas. Y ahí hay distintas estrategias. Entonces, salir del box significa poder tal vez acercarnos a los colegios, a centros comunitarios, tal vez que los centros de atención primaria tengan cocinas donde podamos enseñar a las personas a preparar, a llevar a la práctica esto de comer más sano. Poder también generar proyectos para tener huertas comunitarias donde las personas también aprendan o puedan cultivar sus alimentos, etcétera. Hay una serie de estrategias que tienen que ver con eso de aquí hasta que logramos formar una masa crítica de profesionales de salud.
Si me permitís, Cristian, agregar una cosa respecto a lo que vos decías con lo que decía la doctora recién, es muy interesante porque más allá de que son los chicos la etapa inicial de la vida en donde se educan, el doctor Fuster hizo ese programa que vos mencionabas, el programa Plaza Sésamo, con los integrantes de ese programa televisivo, el programa Plaza Sésamo, que incluso generaron un doctor que era el doctor Rooster, que era el doctor Fuster y que le enseñaba a los chicos, pero con la participación también de profesionales de la educación, no solamente de la salud. Digo, como decían recién, los docentes aprendieron y los docentes enseñaban a los chicos. Y una de las cosas más interesantes, publicó el doctor Fuster, que los chicos, el mayor impacto era entre los 3 y los 5 años, pero de lo más interesante para mí es que los chicos le enseñan a los papás. Si el chico le dice al papá, eso no se hace, eso tiene mucho más impacto que si se lo dice el médico en el consultorio. si el chico le dice, papá, hay que usar cinturón de seguridad, es mucho más probable que el papá se ponga el cinturón de seguridad que si lo ve en un cartel y le hacen una multa por no usar el cinturón de seguridad. Entonces, me parece que ahí hay otro elemento a considerar respecto a lo que vos preguntabas. Disculpen que me metí de nuevo.
No.
Cristian, disculpa, quiero solo acotar algo que se me olvidó decir que me parece importante. Decir también que aparte del rol de los pediatras, es sumamente importante el rol de los padres y de los cuidadores de los niños, porque los niños finalmente aprenden por imitación. Entonces van a aprender de los adultos significativos que tienen a su alrededor. Y en ese sentido, además, bueno, el lóbulo frontal que nos ayuda a tomar decisiones termina de desarrollarse cerca de los 20 años. Entonces, hasta ese minuto, los padres tenemos la misión de cumplir un poco la función de este lóbulo frontal y no tomar decisiones por nuestros hijos, sino acompañarlos en este proceso de que ellos aprendan y puedan tomar mejores decisiones cotidianas respecto a salud, a qué elegir, a qué comer, a hacer actividad física o no, a cuánto dormir, etcétera.
Gracias, Sandra. Sí, Slay.
Bueno, y otra cosa que pienso es que los pediatras siempre dicen que cuando trabajamos con niños muy pequeños, estamos trabajando con personas que aún no tienen hábitos, están creando los hábitos, es como está en blanco. Y para que empecemos correctamente, de nuestro ejemplo como padres, como profesores y como cuidadores. Y cuando se piensa en educación en salud y para niños, es bueno que la información llegue a ellos durante la actividad. Entonces, no solamente, hoy vamos a hablar sobre la importancia del movimiento o de cómo comemos, pero durante la actividad física hablamos porque esto es bueno para ti y les entrega la información, o durante una clase de culinaria haciendo algo saludable que sea sano y hablamos cuáles son los beneficios. Así los chicos también se quieren mejor. Y en Brasil hacemos el programa Paving the Path to Wellness de Dr. Beth Fraves, que es un programa de cambio de estilo de vida que tiene educación, pero también tiene mucha conversa y durante los encuentros tenemos metas SMART y cosas así. Y es bueno para que los profesores se queden con un mejor estilo de vida, se cuiden mejor, pero a partir de eso ellos tienen más conocimiento para hacer actividades con los chicos. Entonces, esto es algo que se queda muy bien acá en Brasil.
Interesante.
Yo quisiera agregar un último punto a este tema, porque, bueno, plenamente de acuerdo en la importancia de trabajar desde la gestación en niños pequeños, pero solamente quisiera enfatizar que es importante que este argumento no se use en contra del generar cambios de hábitos en los adultos, porque yo lo he visto como bastante universal, como una barrera que obviamente plantean los adultos cuando están en una etapa como, digamos, precontemplativa para el cambio de hábitos, pero también es una barrera para la implementación de medicina del estilo de vida. Yo lo estoy viendo en los resultados de acá el doctorado que yo hago. Yo trabajo en un hospital de adultos y acá mucha gente usa el argumento de que esto debe ser implementado en un hospital de niños o fuera, en las escuelas, que ya es tarde. Y es importante aclarar eso. Idealmente queremos prevenir, idealmente queremos que la gente no se enferme, idealmente queremos partir en la infancia temprana, pero no podemos ser idealistas y pensar que vamos a poder lograr eso ahora, y en el fondo tenemos que trabajar todos a todo nivel. Así que solamente quisiera dejar eso también enfatizado.
Gracias, Catalina. Yo no sé, Johannes, si estás no sé si la audiencia quiere hacer alguna pregunta o a los panelistas. Si no, bueno, continúo. Y después hay cualquier cosa me dices, me interrumpes y me dices, Johannes. También otro tema, uno, por lo menos en mi situación particular y lo que veo, ¿no? Es qué difícil es implementar uno tiene que ser muy, muy creativo para poder implementar todo esto en el trabajo habitual, porque venimos de un modelo, o estamos en un modelo donde de alguna manera no permite que, que este tipo de consultas se establezca fácilmente. Hay que ser muy creativo en buscarle la forma en que esto puede ser implementado en la práctica, ¿no? Entonces, yo les quería preguntar cómo o en qué están o cómo ven. Yo sé que es muy difícil lo que es el reembolso de esta actividad, pero ¿cómo podemos hacer o cómo lo ven para que yo sueño con que haya una especialidad, de la misma manera que hay un cardiólogo, un médico de familia, un clínico, todas las especialidades, haya un médico, médica especialista en medicina de estilo de vida que pueda tener su tiempo, sus competencias bien claras para poder este, eh, transmitir todo esto, ¿no? Entonces, quería saber cuán lejos están o cuán cerca que estamos haciendo para que esto ocurra, ¿no?
Tal vez le puedo contar un poco cómo se da esto en Chile. Por lo menos ahora las estrategias de atención en medicina de estilo de vida, la mayoría son en contexto de la salud privada. Y en el fondo, claro, las personas pagan por esta atención y con su seguro de salud pueden luego reembolsar. Eso es donde ocurre la mayoría de estas prestaciones. Hay algunas iniciativas aisladas, como algunos pilotos a nivel de la salud pública, pero están todavía en ese nivel, como pilotos. En algunos centros, un par de centros de salud en el sur, un policlínico justamente que hace una neonatóloga, acá cerca de donde yo vivo, que están surgiendo como iniciativas que son pilotos. Ahora, por eso nos interesa mucho poder avanzar en estas conversaciones y poder incorporar esto como una política pública y que esto de alguna manera vaya incorporándose en el sistema de salud para que pueda ser más asequible para todas las personas, no que esté restringido y sea como una cosa media elitista. Eso pasa también. Y respecto a esto de la especialidad, de poder ir a un médico de estilo de vida, estamos también pensando cómo podemos avanzar en eso. Tenemos una reunión pendiente con el organismo en Chile que se encarga de certificar nuevas especialidades y subespecialidades. El tema es ahí, por ejemplo, cómo diferenciar tal vez un médico de familia de un médico de estilo de vida. Hay varias cosas, o tal vez hacerlo alguna subespecialidad, porque por ejemplo, en Chile, dentro de los médicos certificados y los médicos que son miembros de nuestra sociedad, tenemos desde médicos generales a médicos de familia, que son muchos, y es una tendencia que en el mundo se da bastante. En el mundo son muchos médicos de familia que están presentes en medicina de estilo de vida, pero también tenemos otros médicos, tenemos internistas, cardiólogos, neurólogos, psiquiatras, deportólogos, etc. Entonces estamos viendo ahí tal vez cuál es la mejor forma para poder concretar esto. No lo sabemos aún, tenemos que conversar con esta entidad para ver cómo avanzamos en ese tema.
Sí, bueno, estamos en la misma, así que estaría interesante estos temas, juntar fuerzas y juntar ideas y ver cómo. Sé que es un tema mundial, ¿no? Que obviamente no es solamente parte nuestra y pasa en todos los países, pero me parece trascendental que podamos ser una subespecialidad o probablemente asociada a alguna otra especialidad, que creo que es un poco la estrategia, pero poder implementar esto de una forma más generalizada y para toda la comunidad.
Bueno.
Yo en lo personal no veo si hay Johannes, si me ayudas si hay preguntas. ¿O vos quieres hacer alguna pregunta? Yo la puedo traducir.
I heard my name and I jumped in. So, are you need more time or what's the status?
Fine for me, so it's okay. I have
Okay. Unless somebody wants to have maybe one thing I did. Let me do this with you too. See, that's my magic wand. I did this before. My magic wand, and you have the choice, and you would say, what's the one thing that needs to happen, let's say in Argentina or Chile, for lifestyle medicine to be implemented in a big scale, and especially for chronic disease epidemic to really end or lower it a lot. So what's the one thing you feel is most important, like reimbursement, public policies, or education? What is the most important aspect, the first step you would do with the magic wand? If anybody could just have 1 minute and just share what you think is the most important thing to move this forward.
Entiendo que una de las cosas más importantes es articular esfuerzos, unir esfuerzos, y hoy siento como muy atomizados esfuerzos que se hacen en distintos lugares o en distintos espacios dentro de no solamente de la salud, sino de la educación, y me parece que ahí tiene que ver con esto que mencionabas de las políticas, por ahí una política que permita que todo vaya hacia el mismo lugar y que todos los vectores terminen unificándose para obtener resultados.
Para nosotros en Chile, yo creo que nuestro mayor desafío es poder integrar la medicina de estilo de vida como en el corazón de la atención sanitaria, para que en el fondo cada profesional y paciente pueda tener acceso a estas herramientas que puedan permitir mejorar su vida, su calidad de vida. Y para eso es como imperativo que las competencias de medicina de estilo de vida se puedan universalizar en los profesionales de todas las carreras de salud, idealmente partiendo desde el pregrado, pero también en personas que ya están tituladas y en su formación continua como profesionales.
Yo tal vez agregaría que creo que la disciplina de la medicina del estilo de vida dentro de la medicina es de las que más requiere de las multidisciplinas, y esto no implica solo profesionales de la salud, sino que tenemos que trabajar en equipo, o sea, con todo, desde la educación, como hablamos, políticas públicas, economistas, las personas que diseñan los entornos urbanos, porque en Latinoamérica somos de las regiones donde hay más población urbana. Brasil lo podrá decir, Slay con Sao Paulo, tienen ciudades muy grandes, y creo que eso es tremendamente fundamental. Y también desde mi rol y sombrero que digo como de researcher, investigadora, investigación de implementación local, y demostrar que la medicina del estilo de vida tiene el potencial de generar mejores outcomes en salud, más bienestar a los pacientes, reducir burnout a los profesionales de la salud, pero también la costo-efectividad, y eso hay que demostrarlo. Hasta que no lo demostremos a la gente que pone el dinero y el financiamiento, es difícil que las cosas avancen. Eso.
Who's next? Okay.
Y bueno, en Brasil, creo que la parte número 1, que es entrenar muchos profesionales, ya está en el ambiente, pero ahora creo que es las políticas públicas y ya están empezando a abrirse más para que esto llegue a la salud pública. y para las aseguradoras de salud también, que tiene una ley en Brasil que tienen que hacer acciones de promoción de salud y prevención, pero sabemos que siempre son muy simples y que no tienen el efecto que deseamos. Entonces, ahora tenemos que hacer, en mi opinión, tenemos que hacer pesquisas para que se pueda tener indicadores, inclusive financieros, para que sepamos el poder y la eficacia y la importancia de estilo de vida. Y ya tendremos los profesionales entrenados para eso.
Christian, you want to share too?
Sí, por supuesto que adhiero a cada una de las propuestas. Yo creo que un poco voy a ir un poquito más para atrás. Yo creo que lo que tenemos que hacer es exactamente lo que estamos haciendo ahora, ¿no? Es quizás unirnos un poquito más por regiones, es un poco lo que está pasando, ver nuestras realidades, ver cómo, yo creo que cuanto más impulsemos estos temas, más yo veo que cada vez más financiadores, organizaciones, tanto públicas como privadas, se interesan más en el tema porque la evidencia es tan contundente y va tan rápido que dicen, bueno, algo tenemos que hacer. Evidentemente, todavía seguimos con un modelo de atención de la década del 60, 70, de pensar que el paciente va a venir al médico uno a uno, atención, ir un montón de tiempo para llegar al médico, esperar la sala de espera. Todo eso me parece que tiene que rápidamente modificarse, ¿no? Yo digo que cada uno qué puede hacer, bueno, en su lugar de trabajo, que es lo que vamos a ir mañana, en nuestro lugar de trabajo, generar reuniones y generar acciones para que al menos estemos pensando cómo podemos facilitarle la vida a las personas que tienen problemas de salud, digamos. Si tenemos que generar un modelo de atención diferente, como pueden ser las consultas grupales, porque ya estamos quebrados en el sistema antiguo, ya no, la gente no consigue turno con los profesionales. Es una realidad post-pandemia que se ha hecho más notoria. Bueno, creo que si hay una cosa que hay que hacer es poner el tema sobre la mesa cada vez con más urgencia y desde ya que hay que formar a los profesionales en estos temas, en el pregrado. Bueno, debería haber toda una intención de modificar en varios sectores, una estrategia, bueno, pero para eso hay que hay que seguir con este tipo de actividades, que es transmitir lo que mucha gente no sabe y un poco también lo que decía el doctor Cohen, y digamos, todo lo que llama la atención, la farmacología, la cantidad de drogas que están apareciendo para la diabetes, para la dislipemia, pero estamos siempre tratando a enfermos, ¿no? A gente que ya está con el problema y tenemos que empezar mucho antes. Bueno, hay mucho para hacer, esa es la parte buena y optimista de la charla. Así que bueno, y el entusiasmo nos sobra y por eso estamos acá. Así que bueno, yo creo que si hay una cosa que hay que hacer es seguir con esta estrategia de transmitir y poner el tema de enfermedades crónicas como prioridad absoluta.
Thank you so much, everyone. Let me maybe share also after listening to all the speakers, and we asked by email all the speakers and experts, what do you think is most important? And here's my summary, so to speak, which I think there's just one thing that needs to change, which is incentive or incentives. Because right now we incentivize disease. Also in terms of healthcare, more treatment, means also better income, and so that incentive is not on health and resolving the chronic health issues. And so that's the main thing. We need to change into incentivize living healthy. And I think one specific item would be, from a government perspective, public health, is that just take 1% of the healthcare spending and invest it into lifestyle medicine practitioners and health coaches. And I think we just do that one thing, there's going to be a huge and very fast shift where chronic health issues drop immensely, and we save a lot of money, a lot. So the 1%, as an example, would pay easily by itself. So that's my take. But I want to thank you so much for being here, for, also in Spanish. We're going to make this panel available to you so you can share it everywhere and really bring more awareness to this really, really important issue. And I think we all agree that we need to end or reduce in a major way the chronic disease epidemic. And we all know that lifestyle medicine is that answer. And so thank you again so much, Christian, for hosting, for kind of driving me to set this up, also to do it together. You were so instrumental in making this happen, and to everybody else to be here and share your knowledge and wisdom. So thank you again so much. Muchas gracias. Thank you.
Thank you.
Gracias, Juanes, y muchas gracias a
Thank
todos,
you so
Catalina,
much.
Sandra, Stey, Hernan.
Hope we can do this. We can do this very soon again. Next year for sure.
Thanks. A pleasure to be here. Bye, everyone.
Thank you. Thank you, everybody. Thank you so much. Keep up your great work.
Goodbye. Thank you.
Okay, guys, we're going to be back. I'm going to summarize or kind of close out the summit. We're back in like 30 seconds, and I just spent about 3, 4, 5 minutes to kind of wrap it up and kind of give you specific steps that you can take to take your next step, right? To what is next? What do you do now for a health professional, if you have just health issues yourself, or if you want to have some fun. See you back in 30 seconds. Oh my God, 7 days of the Lifestyle Medicine Summit are over. If you're still here watching, type in the chat box if you enjoyed the summit, maybe kind of share which speaker was really speaking to you or aligning with you. I mean, 50 plus presenters, the topics were amazing. I mean, the Dean Ornish, David Kotz, Beth Freites, I mean, Bernie Siegel, oh my God, Bruce Lipton, right? I mean, and different countries, and bringing the community together. That's the purpose of the Lifestyle Medicine Summit. And I think, and I hope we achieve that and specifically inspire you to get more involved. The chronic disease epidemic is so severe that we need to come up with better solutions, more sustainable solutions, and also solutions, I think, that not just help us to get a little bit better and help us some people, but help a lot of people very fast, because seeing the suffering out there is just unbearable, right? That's not the way it should be. We know that lifestyle medicine can prevent, reduce, or reverse the majority of chronic health issues over time. And that's the mission, to make lifestyle medicine and health coaching accessible to everyone. So let me bring up my slides here to kind of share with you kind of simple steps that all of us can take, right? What's next? And again, that's the vision, and I hope you all agree with that, right? Which this is the means is to make lifestyle medicine health accessible to everyone, is to end the chronic disease epidemic. And I think that's possible. Over time, it's absolutely possible. And it's different factors, but that's the vision. That's what we all want to see very soon. So here, what is it you can do next? Well, first of all, as a healthcare professional, if you're already in lifestyle medicine, get more education, get credentials, right? Very important, because we need to elevate that field. So governments start to notice more and say, yes, this is ready to go mainstream, right? To be like the foundation of healthcare. If you are new to this, start educate yourself, learn how can you implement lifestyle medicine. It can be small steps, right? Just having, if you have 1 or 2 or 3 minutes of time with your patients, or 10, 15 minutes total, talk about lifestyle medicine, that this is really important, not just a little bit, but you need to have it say it in a way that clients know you're serious. This is what they need to do, improve their lifestyle habits. Maybe add a health coach to your practice, or study yourself so you can practice lifestyle medicine, right? Now, if you're interested, if this sounds like, yeah, that's exciting, then consider maybe going to lifestylemedicineworks.com, because we're starting next year based on our thinking, okay, what is it that we can do to scale lifestyle medicine bigger? We're using AI, using education is very specific and pragmatic, so you can integrate and write lifestyle prescriptions, micro-habit lifestyle prescriptions rather quickly. Maybe in 10 days, you go through the training and say, I know enough to get started. And then you build your skills from there, right? Why does it have to be 6 months? It doesn't have to be. Lifestyle medicine is about helping clients to improve their lifestyle habits. And there's some things needed, but it doesn't have to be necessarily a 6-month or 2-year or 5-year training to get started, the 101 version, right? Go to the website, and especially if you say, here, I want to learn this. At the same time, I want to participate in a research project, a pilot project, to actually measure and test what works best for clients and what especially works best for your practice, right? I think we need to make it easier and simpler for physicians and healthcare professionals to implement lifestyle medicine. So the whole lifestyle medicine works project that we're running on or working on right now is, how can we simplify this for you so you save time, you're less burned out, and you have got a great service available for your clients and patients. Okay, next thing, if you have chronic disease, right, or have you some symptoms and it just doesn't go away, and you managed it for some time, but you want something different, you want an option, you want lifestyle medicine, you want to reduce and reverse even the chronic symptoms, right? Then a couple things. First, talk to your doctor and say, or a healthcare provider and say, ask very confidently, do you offer lifestyle medicine? I want lifestyle medicine for this. Do you offer it? If they're not offering it, ask them, will you offer it at some point? If they say no, not at all, maybe find someone else. Find someone that has some kind of holistic lifestyle medicine approach. You're going to benefit so much. Right now, you can start right away. We talked about that a few times, right? You can start, make a decision, a very conscious decision. You practice a new habit. Don't think about it. Don't read books, right? Forget about all this for now. Just pick one habit and say, okay, that's what I'm going to practice. Simple things. Improve diet a little bit, like get rid of sodas, read labels, write a journal, things that you can do easily, and then practice it for 7 days. Don't think about it. Do it. Okay? Practice, pragmatic. And then number 3, obviously get help. If you need more support, get help. Find someone online, I guess, or in your local area that is into the kind of holistic, natural type of lifestyle medicine. That's really it, right? It can be simple. So either study as a professional. If you want to have a new career, then definitely going to study and learn more and become a health coach or a lifestyle medicine practitioner, get your degrees in lifestyle medicine at our university, obviously Lifestyle Prescription University. or for yourself, start implementing new habits into your life. And the third thing is have fun. And we're going to have fun at our Lifestyle Medicine Global Award. We don't share yet who's going to be the awardee for the Global Lifetime Award and Achievements in Lifestyle Medicine. It's actually one of our speakers. I shouldn't say that. What I did. But you know, I'm going to share that soon. It's someone that absolutely deserves it. And we're going to have a great time with music, with the award ceremony, and the talk, the laudatio from our awardee. And we also have a small graduation, because for our Lifestyle Prescription University, 2 of our first students have graduated or graduating right now for their PhD in lifestyle medicine, and they're going to share their work. What did they do the last 3 or so years, or 3 years? What did they research? What was the outcome? And they're going to share that, and they're going to be going through the graduation. And so we're going to have a great time. And please join. You get an email very soon, in a couple of days, and we invite you again. So that's really it. Thank you so much for being part of the Lifestyle Medicine Summit 2024. See you soon. We have podcasts that we're going to start again. We're going to have a lot of other things coming up. Stay on the email list. And if you need anything, let us know. Okay. Thank you. I hope you had a great time with the summit. Thank you so much. See you soon. Thank you. Thank you.